Welcome, Bob Marley, Surnu. Welcome, happy to have you here. Or maybe welcome back. I think we last saw each other about 7 hours ago, maybe 8 hours ago, during the workout stream, which was great, as always. I'm happy to be back. And also, what I should say, Bob Marley, like, yes, as I am embracing what little of the Chinese culture that I have left in me. I'm pretty much like fairly whatever, fully westernized. As much as I'm proud of my heritage, I'm like very much like disconnected, pretty strongly from the Chinese half of my family. And yes, I did get a haircut. It It was almost exactly a week ago, because I was getting pretty shaggy, at least for me. I try to keep things cut. Keyword on try. Oh wow. Death of Certainty, thank you so much for the raid. Super appreciated. Welcome raiders. Shout out to Wick. I was definitely in and out on the panel that you just had on political violence.
Welcome to Flavor Country.
Thank you so much for the follows, and welcome Politics for Life. I definitely know you. I have seen you in Wick's channel, Prime's channel. And thank you so much for the follow. Don't Smile Dean.
Welcome to Flavor Country.
And what 88. Thank you so much. Welcome everybody. I'm sure there's some of you that know me. I'm Corey Campbell. I've been very much lucky to be on Wick's panels. Quite a few Wick's panels. I've been lucky to be on Prime's panels. So super grateful. I'm in Portland. Welcome. Shout out to Portland. Portland is burning, to be specific. They stream occasionally, and they're also on Wick's panels. Oh, and Paul, welcome. Thanks so much for passing by, or coming in with the raid. Yeah, can't thank Wick enough for all the opportunities that he gives me to spread my dirty left ideas. My night is going well. Actually, my day. It's been a very nice Friday. I've had some productive meetings at work. I had a nice workout stream, and now I'm back, hopefully doing a nice science and news stream. And I've been very happily greeted with a raid from Wick and all the great fellow chatters. So super appreciated. But yeah, what was I saying? Right. I just got a haircut. And also on the topic of my inconsistent streams in the past few weeks, as I mentioned before, and as I mentioned during my workout stream, I'm in a little bit of kind of a transition period in my life in terms of, my career or professional development, where it's yeah, I'm pursuing the PhD and I was working part-time. Now it seems like, I might be I'm trying to figure out what direction do I want to go, because my part-time job, the company is really pressuring me to start working full-time. I'm really taking on quite a bit more responsibility, which is not a bad thing. But it's something has got to give, as I said many times before. As much as I can wear many hats, I'm pretty good at balancing things out. Everyone has their limits, myself included. And so I'm pretty much in the next few weeks, I have to commit to making a decision of, what direction do I want to pursue for maybe the next year or so, year or two. Do I want to start working full time, commit to that for a year, and then go back and return and finish the PhD? Or do I just go all in on the PhD? But there's some very clear drawbacks in doing that. And there is totally the financial incentive to work for a company, because the PhD is not financially lucrative. As I've mentioned before, every day that I spend pursuing the PhD, it's basically me losing money, because any minimum wage job in my area pays more than the PhD. So basically, any time that I'm not devoting to working a minimum wage job, i.e. working the PhD, I'm losing money. And the company that I work for pays way more than minimum wage, thankfully. And I've been lucky to have the opportunity. I have no interest in taking over the earth, Paul, unless somehow that opportunity falls in my lap. Even then, I think I'll probably pass on that. Prime Minister of Canada, as much as I'm interested in politics, I don't. My concern is, how uncorruptible these. Oh, true, yeah. Is it Animaniacs or is it Pinky and the Brain? Can't remember, or both. And to answer your question, Bob Marley, what do I do in between workout streams and now? So typically, I get some work done. But I also try to eat something, have a little bit of a snack. If not, today I had a full meal. And pretty much I take a little bit of downtime. Like I rest for like, good 30, 45 minutes. I did watch like one episode of Seinfeld on Netflix. So I tried to like mix in work, recreation, rest, etc. And eating, obviously. Nourishment. I can't do without. So, yeah, pretty much wrapping up. I have some tough decisions to make in the next couple weeks. And I'm leaning towards, like, I don't know, I should probably just, like, put the PhD on pause, pursue the full-time position with the company, and then just, like, reassess when I get fired or after a year. Whichever comes first. But until then, I'm still just mulling things over. I'm still trying to get back into regular streaming routine. Still committed to at least one workout stream per week, and at least like one science and news stream per week. Hopefully 2.
Welcome to Flavor Country.
We are going to dive right into, I guess, there's a lot that I want to cover. I'm probably not going to be able to get to it all. I probably have to put stuff on the back burner. But to start with, like, and thank you so much for the follow. Armand, I know, I'm pretty sure, if I remember correctly, you're from Scott's or Fabian Liberty's community. Your name is totally ringing a bell in my brain. Welcome. Thank you so much for being here and the follow. Happy to have you here. Even though I know that we have some fundamental disagreements, I'm still happy and glad to have you here. So yeah, based on the main topic of my stream title, I had this on my last stream title, but I didn't get to cover all I wanted to cover. So we're going to start with it here, where, yeah, I'm focused on pretty much like in my area, which is Quebec. And there's like pretty much like daily stories of, record overcrowding in emergency rooms. And, record, staffing shortages, bed and space shortages. And there's like these sad and tragic stories like these, where this was published like 3 weeks ago, 2-3 weeks ago, where it's like, yeah, our ERs are pretty much like just about every hospital ER, like running at like max or exceeding capacity. Pretty much, well, it's right here. And this is, one of the tragic or sad, I guess, collateral damage or consequences of that. As long as you recognize that. So, and Float U32, welcome, and also thank you for the follow. So this is a mix. I'm not going to narrow it down to like one specific thing where it's like this is directly a result of COVID. The pandemic definitely made things worse. It's not helping, but this is kind of like the straw that broke the camel's back, as they say, where it's like even before COVID, our healthcare infrastructure was like pretty flimsy. Yes, there's very many benefits to having public healthcare. But there have been criticisms and calls to overhaul the healthcare system in Quebec, in Canada, for multiple years, like going back decades. And now, as a result of the pandemic and a bunch of other factors, like it's it looks like it's crumbling, or it's like it's in real dire circumstances. So it's not specifically COVID, because there's also many healthcare workers have understandably left the healthcare system, either retired or retired early, or they just went on to pursue a totally different career. And there's also the fact that some of the hospitals that are still like working are like, they're very old buildings, and the investment in infrastructure is just not there, or hasn't been there for the longest time. And so it's like at a tipping point, and it's just like, pretty much like the perfect storm to result in kind of, hopefully not, but on the brink of healthcare collapse. So, the case of a patient who died after spending 16 hours in a Quebec hospital's emergency room without being seen by a doctor is prompting physicians to denounce conditions in the province's health system. The incident was brought to light by Dr. Sébastien Morin, an emergency room physician, who detailed the incident in several Twitter posts Saturday. According to Morin, the deceased patient, a man over the age of 70, went to an unnamed hospital but returned home because no doctors could see him after 16 hours. Morin is not divulging the name of the patient nor the hospital, citing patient confidentiality. And another one of the variables at play is that there's a huge shortage of family doctors or general practitioners, pretty much, not only in Quebec, but like all across Canada. And I think this holds true for many countries. I think in many parts of the United States too, where it's like, since many people, too many people, don't have a family doctor or access to like a general practitioner, they use the ER as pretty much like, their family doctor. Or it's like, only when they have a crisis that they go seek medical treatment because they're not being regularly seen by a family doctor or general practitioner. And that's just another variable at play. His condition deteriorated, prompting him to seek medical care again. This time at a different hospital. He chose to go to Barrie Memorial in Ormstown, south of this area where Morin works. Morin told Radio Canada that he quickly realized there was an aortic dissection, essentially an issue with the heart, basically. The man died about 10 minutes after arriving at Barrie Memorial. Morin said that according to the man's medical file, he had suffered an aneurysm recently. This is a case that fell through the cracks of the system. Morin said this is a case that was still quite clear, a case that was dangerous. Is the shortage due to low wages? Depends on how you frame it. Because like, as mentioned, like a staffing shortage is one of the reasons why there's a healthcare crisis. And one of those is not only a shortage of doctors, but a shortage of nurses. And a bunch of other healthcare workers like technicians, etc., etc. And, again, going back decades pre-pandemic, nurses have been calling for, better salaries, better conditions. And since those calls have largely gone unheard until, the pandemic and, all of the outpouring in words only of how much we value healthcare workers. But it's only then when it got to, dire circumstances during the pandemic, did they, increase the salaries of nurses as an incentive to hopefully lure back or retain nurses so that, they don't quit during the pandemic or they don't go to the private sector. So totally low wages of nurses is definitely also a variable at play. But when it comes to physicians or doctors specifically, I don't believe that it can be attributed specifically to low wages. Yes, I would still say, generally speaking, that Canadian doctors are underpaid. But generally speaking, based off of the data that I have seen, medical doctors are generally pretty happy with or satisfied with their salaries, but it's like the working conditions that they're complaining about, or like, staffing conditions and, hours, etc., etc. They're typically like not complaining specifically about salary, and even then, when the government has tried to basically incentivize more doctors or keeping doctors in Canada by increasing salaries, it actually doesn't appear to work all that well. As in, salary incentives for doctors, they don't appear to respond all that well to them because they're really not complaining about that. They're complaining about the conditions, the working hours, and staffing shortages overall. And so basically, to answer your question, I would say it's low wages is a part of that, especially when it comes to nurses. That seems to be less of a variable when it comes to doctors and physicians. Absolutely, a lot of nurses quit. Totally. The numbers, at least based off of the numbers that I've seen in Canada, or Quebec specifically, totally, that is true. And yes, I'm more than willing to admit that a certain percentage of nurses were pushed away as a result of vaccine mandates. I can acknowledge that. But if you look at the breakdown of the numbers, it's a very small percentage of nurses or healthcare workers in general that were, forced out as a result of the vaccine mandates. In USA, does not help that they leave a nurse in lifelong. Absolutely, I 1000% agree with you, Paul. I think we're not going to deviate much, if at all, when it comes to that. Do you think the Canadian government to legalize weed so everyone would be too high to commit violent crimes because they knew the hospitals? I mean, that's not the most far-fetched conspiracy theory that I've heard, but I don't think that was the motivation, because cannabis has been legal now in Canada for, 4 years? 3 years? Something like that. 3 to 5 years. And it generally came from the place of, we recognize, where this is where the US is lagging behind Canada, where they recognize that putting massive amounts of people in prison for, petty drug crimes, cannabis possession or consumption, is just, super silly. And not only are you ruining people's lives, it's a waste of resources, too. CBC News has not been able to confirm the name of the first hospital, Dr. Morin's account. However, the province's health ministry has confirmed it is investigating. I see patients dying every day. That's life, but he shouldn't have died, he added. ER overcrowding raises fears of the worst, says doctors. And yeah, here's where, the winter months, winter is coming in Quebec or in all of Canada. And I'm really concerned for how the next, 4 to 6 months is going to play out, because it seems like we have a pretty, bad mix of there might be a spike COVID cases, but in addition to that, it's looking like it's going to be a not good flu season. And also there are other respiratory viruses that appear to be circulating as well. For example, respiratory syncytial virus, RSV, appears to be circulating and disproportionately affecting children. And so again, it's just it looks like, potentially, obviously I hope for the best, but it looks like, a tidal wave is headed in our direction. I like to think we're polite, but I have definitely, especially in Quebec, there are totally impolite Quebecers. And I totally, just about every degree, I'm not going to take that bait, Bob Marley, because I know what you're going to say, but I agree with you. Nursing is a good degree, as virtually every other degree, including arts degrees. Dr. Gilbert Boucher, president of the Association of Specialists in Emergency Medicine of Quebec, says overcrowded emergency rooms put the population at risk. We are always surprised by this kind of thing, said Boucher, alluding to the death of the patient. We still hope that the triage system will ensure that we won't overlook conditions like that one, he said. Unfortunately, over the last 5 or 6 months, many patients have left without having seen a doctor. Our triage nurses are doing a great job, but they too are under pressure. Boucher is worried not only about the risks of forgetting a patient because their file wasn't evaluated properly, but also about the dangers of having to wait hours in the emergency room for treatment. We put caregivers in unbearable situations. Totally true. There are no beds, there are no stretchers, the waiting rooms are full. Decisions have to be made after interviews of 3 to 5 minutes. This is when it gets incredibly dangerous. A clear message has been sent to those in charge of the health network and to the government, said Boucher. There are risks for the population. If this patient had been seen within a reasonable time, we're not saying that he would have survived, but at least he would have had a chance. Where it's it's really difficult to, say with, 100% certainty that, as a result of the excessive wait time, this patient died. But as they framed it, if they were seen within a reasonable amount of time, at least they had, they would have had a fighting chance. But definitely, I think we could say that the 16-hour wait time did not help anything at all. So the CAQ, this is our current political party that's in charge in Quebec. This is the basically the coalition Avenir Quebec. That's its health plan. The health ministry says it will request a detailed report from the first hospital. In an email, a spokesperson for the health minister Christian Dubé also touted the Coalition Avenir Quebec's plan for the health network. Yeah, that's the CAQ. The spokesperson said the plan offers several solutions to improve the situation in emergency rooms, in particular with access to frontline care, the hiring and development of more health professionals, and adding capacity in other parts of the network in a bid to alleviate the strain on ERs. But Morin says he's not getting his hopes up. I believe in reform, but it will take a long time, he said. It has to be done right for it to work. We're gonna see how it pans out, but it's not looking good. And it looks like, there are no short-term solutions that will help immediately. And that, it's gonna be, if in fact there's any improvements, it'll be like a long road ahead of us. I need to have that viewer panel on the value of arts degrees, how they are valuable. Isn't there like a program or something to incentivize people to go into medical fields, since it's like public thing? It's tricky. Because generally speaking, at least in Quebec, when it comes to medical schools, so there are quotas for medical school, as in it is pretty much like government mandated. They can only accept a certain number of people who enroll in medical school, and generally speaking, for just about every medical school in Quebec, the number of people that apply, far exceeds the number of people that get accepted. Where I think just about everybody knows, generally speaking, getting into medical school is a highly competitive process. And that, for example, I know one university, major university in Quebec, if I remember correctly, because I've looked into it, they accept around, I think, like 120, 150 medical students per year. But it's about like 500 or 600 that apply, or something to that effect. And so like the incentive appears to be like basically built in. And is it simply a matter of like the university increasing enrollment? No, not necessarily, because like it's government enforced, as in the government enforces that pretty much like this university, you can't accept more than this number of medical students per year. And maybe it is just a matter of like, the government easing or allowing the universities to accept more students. But then, it gets even more tricky. I have a number of friends who have gone on to medical school as and a number of friends who I've literally taught them biochemistry, and then they have gone on to get their medical degree. Because, many people who pursue the sciences or like a biochemistry or biology degree, they do so for the purposes of going to medical school somewhere down the line. So like I have a pretty decent insight into medical schools and, medical education. And so yes, even if the universities accept more students, but after medical school and residency, they have to be trained. And basically a lot of the training process of medical students or doctors, it comes from other doctors, right? And so if we know that there's a doctor shortage, and there's not enough doctors to treat patients, well then there's not enough doctors to train other doctors. It's kind of like this snowball effect. Where it's sure, the government can allow universities to accept more students, and the universities can accept more students, but then once they're going through medical school, they need access to doctors to train them and learn from them, right? Because not only are there doctors practicing medicine, but they're also teaching and training other doctors, right? They are the practitioners and the teachers. And so if there's a shortage of doctors, well, we have a shortage of practitioners, we have a shortage of teachers. And so it's like a vicious cycle, right? Where, as I sort of alluded to, it looks like, it's going to be a really long-term solution somewhere down the road. Or any real positive improvements going to be over the long term. It may just be a matter, or like what might help is accepting doctors internationally, or streamlining that process. Because like, yes, another issue is that, and I'm not saying this is like a bad thing, there's understandable reasons why Canada does this, where like, you know, not every person that has gone to medical school in every country is able to come here and practice medicine. Like I know, I have some friends who, you know, let's say for example, their parents are from India, and, you know, they've gone through medical school in India. They can't come here, or when they have immigrated here, they can't practice medicine here, or they need to be like recertified, and to become recertified, a pretty lengthy process. And so like, yeah, it may just be a matter of streamlining the process of, you know, allowing internationally trained doctors to be able to come here and practice medicine. That might be a potential solution, which I'm open to. I'm not necessarily looking for just like, you know, the one thing that will solve everything. It's certainly going to be, you know, a number of things that need to change, because a number of things have gone wrong in the medical system. Can't they find like, and also Moon, welcome. Thank you so much for passing by. Happy to have you here. Can't they find like, find smart kids and kind of teach them to be doctors when they grow up? It sounds like a bunch of people are not able to pass tests or something. So it's, I can see that as, you know, again, as a potential solution somewhere way down the road, because like, you know, I'm also for revamping the education system, because, you know, I think there are clear sort of like fundamental issues. Education is done here in Canada and the United States, or pretty much like every other developed country, where it's like, yeah, there's definitely changes that I would want to see, because as I alluded to, you know, one of the reasons why I have quite a few friends who have gone on to medical school is because, like, well, I have made I've been in academia or in, you know, the biochemistry department for so long, and I've taught biochemistry for so long, and one of the large reasons why people pursue a biochemistry degree is so that, you know, they can have like a good, you know, science educational background, and then they can go on and apply to medical school. So basically, like they are getting like an entire bachelor's degree before they get into medical school, and that's clearly not ideal process. And like things need to change in terms of like how we admit students into medical school, how we screen them, and that this, you know, ultra competitive nature to medical school, I would say is like not really a good thing, and that there are so many better ways to do it. So, furthering on the topic of, you know, or more evidence that at the very least Quebec healthcare is in crisis, but I have other things pointing to this is not just isolated in Quebec. So, Quebec to free up 1,700 beds as urgent care chiefs say ERs are victims of a failing system, as I just have been going on and on about for the past, you know, 45 minutes. So, damning letter was penned by a group representing ER chiefs, province. Issues within Quebec's healthcare network boil down to a coordination problem, says the province's health minister, hours after a letter underlining the dire state of emergency rooms was made public Tuesday. And this was published, you know, a little over a week ago, or like 10 days ago exactly. The letter, meant for hospital leaders, so this was a leaked letter. It was not intended to be public. And health officials said the province has systematically failed to support its overcrowded emergency rooms, leading to a tense and potentially deadly crisis. And I think, as I just showed you, there's a pretty strong argument that it's a deadly crisis. The situation in the emergency rooms that we have is not only in Quebec, it's all across Canada. That seems to hold true based off of what I've seen. Dubé said at a news conference, but that's not an excuse for not having done what we should have done. The minister said the province needed to focus on measures that everybody knew of but never implemented. And this is pretty much like the sentiment. This sentiment goes back way pre-pandemic. Goes back like 10, 20 years. Where it's like, there have been calls over and over for like something needs to be done. This is not sustainable. And then, the pandemic happened, and like lo and behold, it did not sustain itself, and like it's collapsing. It's a question of execution, he said. We want to better coordinate our services before the patient gets to the hospital. In response to the letter, Dubé presented Quebec's crisis team's first recommendations to alleviate pressure on emergency rooms and encouraged Quebecers to call the 811 health line instead of immediately turning to the ER. Quebec will make 1,700 beds in private seniors' homes and long-term care homes available for patients recovering after an operation. Dubé says nearly 1,000 of those beds will be ready in the coming days. We're very aware of the regional aspect, but the problem with emergencies is even more glaring in Montreal. Everyone is fighting for the same bed, which is, understandable. Montreal, major Quebec city. And, that's where hospitals get the most traffic. Believe me, as a result of my condition, I've spent many a time in the ER pre-pandemic, and always like overcrowded. As of Tuesday afternoon, for example, Montreal's Jewish General Hospital had 116 patients admitted, but only had 53 stretchers available. Like, they're pretty much over capacity by whatever. Basically, they're at like 200% capacity. Over 200% capacity. At least 27 of those patients were on a stretcher for more than a day, and 13 spent more than 48 hours on a stretcher. Dubé said 500 of those beds would be in Montreal. Quebec is also planning to open 2 clinics shortly, where specialized nurse practitioners can treat patients for emergencies. One will be set up in Montreal's East End, and the other in the city's South Centre. ERs disproportionately bear the burden. The letter was penned by Dr. Marie-Maude Couture, the president of... I'm not going to attempt... My French is awful. Representing the province's chiefs of emergency... representing the province's chiefs of emergency. So just a group representing the chiefs of emergency medicine. The letter was not meant for the public eye. Radio Canada obtained a leaked copy Tuesday morning. It says that the RCUQ wrote to make management teams aware of the serious problems earlier this summer, but found that ERs have not received the support of our management. The letter says that a lack of hospital beds in other departments forces ERs to disproportionately bear the burden of hospital overcapacity, which has a ripple effect on urgent care. Well, you're not wrong. You might say that jokingly, but I would say there's absolutely an element of truth. And totally, I have no problem admitting I am an Anglophone in Quebec. And generally speaking, the Québécois, or, French-speaking Quebecers do not really take too kindly to me. And I understand that. Totally. And I have no excuse to not know French. I should know French. And at one time, my French was decent and passable, but it has just like slowly degraded over time. Or maybe I'm just becoming more and more brain damaged over time. Or both. Emergencies are now condemned to sacrifice their primary mission, which is to treat in a timely manner people whose clinical condition is unstable or even potentially deadly. Our emergencies are the victims of a failing system, and it's our patients, our staff, and the population who suffer from a disorganization of our establishments. The health boards have a responsibility to regain control of the situation, the letter says, especially as healthcare providers prepare for another wave of COVID-19, coupled with the flu this winter. This is what I alluded to earlier, where it's like it's looking like there might be a wave of COVID-19, and that it's looking like going to be a bad flu season. And there's also, again, it appears that respiratory syncytial virus, or RSV, another respiratory virus, is circulating as well. So it's not looking good on paper. Couture, the author of the letter, declined an interview request Tuesday morning. Dr. Judy Morris, the head of the Quebec Association of Emergency Physicians, echoed the concerns laid out in the letter Tuesday morning, saying the letter was an appropriate response to the government's handling of the situation. People were hoping, regionally and across the healthcare establishments, that people would take appropriate measures to solve the crisis. But very little has been done, she said. She said the solution to overcrowding in emergency rooms is to make beds available in other departments so patients can be transferred appropriately. But it seems that in the healthcare network, everyone is able to close their door and say, no, we're full, or no, we're at maximum capacity. In the emergency room, we're not able to close the door, and rightfully so, but it's led to the numbers we've been seeing. Dr. Antonio D'Angelo, the head of emergency at Saint Justine Children's Hospital in Montreal, said the situation is distressing and does not appear to be getting better. D'Angelo said that at his hospital, they're seeing about 250 to 300 children every day. Many of them require hospitalization, but he said they also struggle to find beds for them, saying some wards are completely full. We have nursing shortages everywhere, and we're very, very concerned about the safety of the patients in our emergency rooms, he said. Like, yeah, not looking good, and Quebec, clearly, it's looking like it's pretty much either on the brink of crisis, or I think it's pretty clear that it already is. But does not appear to be isolated only to Quebec, and pretty much like all of Canada appears to be struggling. So this comes from the province next door, Ontario, specifically like from Toronto, Toronto Sick Kids, which is a major pediatric hospital in Ontario. If not, I think one of the largest in Canada, if not the largest. Can't remember. But either way, pretty, well-renowned pediatric hospital in Canada. Pediatric unit at Mississauga Hospital consolidated with that of Credit Valley Hospital. Toronto's Hospital for Sick Children says it will reduce the number of surgeries it performs starting on Monday to preserve its ability to provide critical care as it grapples with a spike in respiratory infections. And yeah, just like I was saying, it seems like, these circulating respiratory viruses are disproportionately affecting young children. And it seems like there's a pretty significant uptick in children requiring hospitalization. And part of that is driven, or maybe a significant portion of that is driven by these circulating respiratory viruses. In a statement on its website on Friday, Sick Kids said the move will enable the hospital to make urgent, emergency, and time-sensitive surgeries a priority. Its administration teams will contact families whose scheduled procedures will be affected, the hospital said. Sick Kids said it had no choice but to make the decision. The hospital said its intensive care unit has been above 127% capacity for several days. More than half of its ICU patients, which includes cardiac ICU patients, are breathing with the help of ventilators, it said. This decision was not taken lightly, Dr. Ronald Cohn, president and CEO of Sick Kids, said in a statement. The reduction in surgical activity will allow us to support areas of the hospital that need help, managing increasing patient volumes and acuity, including the critical care units, pediatric medicine, and emergency department. The hospital said its community partners have also reached their maximum capacity, and it is now supporting doctors virtually to care for pediatric patients who would otherwise receive care at Sick Kids. Endoscopy services and image-guided therapy provided by the hospital will also make urgent cases and patients already in the hospital a priority, it said. Other hospitals in the Greater Toronto Area are making decisions as well to cope with an influx of children who need care. Trillium Health Partners said in a statement on Friday that it has consolidated the pediatric unit at Mississauga Hospital with that of Credit Valley Hospital. All pediatric patients are being cared for at Credit Valley Hospital currently, it said. Trillium Health Partners is a hospital network with 3 sites: Credit Valley Hospital, Mississauga Hospital, and Queensway Health Center. By working together on one site, our clinical teams have been able to keep the same number of beds open to support children and families in need, Healy Rogers, spokesperson for Trillium Health Partners, said in a statement. We want to assure you that this has not decreased access to high-quality care in our community and region. Rogers said Mississauga Hospital's emergency department remains open to pediatric patients, and if they need to be admitted to hospital, they will be transferred to Credit Valley Hospital for care. As part of our surge plans, we will continue to reassess our space to ensure we are maximizing all available bed spaces within our hospitals, actively recruit new staff, and introduce additional clinics and resources to support our children in our community. So this is not only a Quebec thing, this is all across Canada. And as you can see here in related stories, further evidence that, as mentioned in the title of my stream, Canadian healthcare is in really bad shape. But it's been in, not great shape going back decades. It's just like, as mentioned, the pandemic and a bunch of other factors has really accelerated basically the collapse of the healthcare system. Where it's if the government actually listened to what the experts were saying and what needs to be done for infrastructure and investment, this probably or almost certainly could have been avoided. But since the calls went ignored, we're in this dire situation. But this does not appear to be exclusively isolated to Canada. There are totally some issues in the United States that maybe I'll cover on a future stream. But, across whatever the Atlantic Ocean, in the UK, it does appear to be also the case that they are having pretty significant issues in their healthcare system as well. I need something to drink. So, this was published a little over a month ago. I had wanted to cover it a month ago, or when it was first originally published a month ago. But, just too many things to get through. So, NHS waiting list hits 7 million for first time ever. The NHS waiting list for treatment has hit 7 million people for the first time ever, as A&E trolley waits also hit a record high. New data from NHS England shows there were 7 million people waiting to start routine hospital treatment at the end of August. This is up from 6.8 million in July and is the highest number since records began in August 2007. Meanwhile, the number of people enduring long trolley waits, referring to the time spent in A&E before people are found a bed on a hospital ward, has also risen. The number waiting more than 12 hours in A&E departments in England from a decision to admit them to actually being admitted hit 32,776 people in September. This is up from 28,756 in August and is the highest number in records going back to August 2010. The number waiting at least 4 hours for a bed stood at 131,861 in September, up from basically 130,000 the previous month, but below the peak of 136,298 reported in March. A total of 71% of patients in England were seen within 4 hours at A&Es last month, the joint worst performance on record, set against a target of 95%. Delays discharging patients to community and social care partly to blame. NHS England said delays discharging patients into community and social care is impacting how many free beds are available, with only an average of 40% of patients discharged when they were ready in September. Elsewhere, a total of 387,000 people had been waiting more than 52 weeks, which is a year, to start hospital treatment at the end of August. This is up from 377,689 at the end of July. Right, and is the equivalent of 1 in 18 people on the entire waiting list. The government and NHS England have set the ambition of eliminating all waits of more than a year by March 2025. 2.5 years down the road. The data showed there has been progress on 18-month waits. They are down by more than a quarter since the NHS launched its elective recovery plan in February, and now stand at basically 51,000 people. SEVA Ananda Siva, chief analyst at the King's Fund think tank, said, NHS services are facing a range of really serious challenges which impact on patients and the quality and timeliness of care they receive, including crumbling buildings and outdated equipment, long waiting lists for care, high levels of COVID-19, and growing staff shortages. The NHS England figures showed a record 255,000 urgent cancer referrals were made by GPs in England in August, the highest monthly total in records going back to 2009. You are asking a critical question, Sternu, which, no surprise, they're probably not going to be all that transparent of how they plan to do that. These are like literally the same thing that, politicians here in Quebec say about, our increasing wait times. It's like, yeah, we plan to reduce wait times by this target, by this time and date, or by this date. And it's like, well, so what are you going to do to achieve that? And it's like, they don't really say anything. They're just like, yeah, we're working on it. Have faith. But obviously, like, if it happens, great. But it's no surprise that, they don't appear to be all that transparent or forthcoming with, like, what actual boots-on-the-ground solution are they going to implement to actually achieve that goal that they are setting. However, only 75.6% of patients in England saw a specialist within 2 weeks that month against a 93% target, the second worst performance on record. Some 69.5% of patients urgently referred for suspected cancer were diagnosed or had cancer ruled out within 28 days in August, down slightly from 71.1% the previous month, and the second worst performance in records going back to April 2021. And so, just as I mentioned, the healthcare issues in Canada, there are multiple variables at play. I have no doubt it's the same over in the UK. And I think, so another variable at play that's kind of like, really stressing our healthcare system is like, understandably, many people, kind of like put their healthcare on hold during the pandemic, or like, put, for example, like their cancer screenings on hold during the pandemic, or, the cancer diagnosis process on hold during the pandemic, just because, like, the resources weren't there. And so, like, there's kind of like this backlog that is built up. Like, we know there's a surgical backlog, okay? And now there's probably, kind of like a diagnosis or screening backlog, where it's like, yeah, since many people went undiagnosed for certain conditions, such as cancer, during the pandemic, now you have kind of like an influx of people that is like, yeah, now they're getting screened for cancer, and, unfortunately, they're getting diagnosed with cancer, because, like, yeah, for like the past 2 years, it was something they were just kind of like putting on the back burner, or like, they started like the screening process, but they never actually were able to finish it because things got put on hold, etc., etc. And so I have no doubt that's also a contributing factor for, this added stress on the healthcare system. The elective recovery plan sets a goal of March 2024 for 75% of patients who have been urgently referred by their GP for suspected cancer to be diagnosed or have cancer ruled out within 28 days. And yeah, this is pretty much just exactly what I alluded to, where it's like, very often GPs will refer, patients suspected of cancer, so to be screened for cancer. And understandably, well, we already know, as I mentioned, that a large proportion of people in Canada don't have access to a GP or family doctor. And also, even the ones who had access to a GP in Canada, they put their GP visits on hold during the pandemic. And so, like, basically, all of those people who would have been regularly, referred to a specialist if they were suspected of cancer, you probably have like this 2-year gap where, like, very few people were referred. But like now that they're able to see their family doctor, we just have like a huge influx of people that are like being referred and that they need to be screened and or diagnosed with, certain diseases or conditions such as cancer. More than 30% waiting longer than 6 weeks for a diagnostic test. The number of people in England waiting longer than 6 weeks for a key diagnostic test has also risen to its highest level since the early stages of the pandemic. Some 461,000 patients, or 30.5% of the total, were waiting longer than 6 weeks for one of 15 standard tests in August, including an MRI scan, non-obstetric ultrasound, or gastroscopy. This is up from 424,605 the previous month, and the highest number waiting since August 2020, when 472,517 patients had been waiting longer than 6 weeks. When it comes to ambulance response times, the average response time in September for the most urgent incidents, defined as calls from people with life-threatening illnesses or injuries, was also up to 9 minutes and 19 seconds. Analysis by the BBC suggests the NHS is carrying out fewer operations and treatments than it was before COVID, by a push to boost capacity. In the past year, an average of nearly 257,500 inpatient treatments, including hip and knee replacements, have been performed each month, 12% lower than the year before the pandemic, it said. NHS England said monthly figures comparing August 2022 with August 2019 show a 4% rise in patients receiving treatment. Responding to the overall figures, NHS England said the number of people receiving cancer treatment continues to be high, with well over 27,000 people starting cancer treatment in August. The number of the most serious ambulance callouts in September, 69,458, is also up by a fifth compared with before the pandemic, at 55,753 in September 2019, it said. NHS National Medical Director, Professor Sir Stephen Powis, said, despite huge pressures on the NHS this summer, the incredible work of colleagues across the country meant that in August we delivered more potentially life-saving cancer checks than ever before, and cut 18-month waits by 60% over the last year. This was despite continued pressure from COVID patients in hospital, which has now risen to more than double the number seen in August, and more of the most serious ambulance callouts than before the pandemic. Shadow Health Secretary Wes Streeting said it is totally unacceptable for millions of people to be left waiting months or even years for treatment, often for painful and debilitating conditions. Liberal Democrat health spokeswoman Daisy Cooper said behind these figures are countless human tragedies. In every corner of the country, people are frightened, suffering, and waiting in pain because our NHS can no longer cope. These are like basically the exact same sentiments that you basically hear government officials, or healthcare officials say in Quebec and Canada. Long-term solution needed. Responding to the latest performance figures from NHS England, the interim chief executive at NHS Providers, Saffron Cordery, said, today's figures underline the ongoing and serious challenges facing the health and care sector as we head into winter. Despite the best efforts of trust leaders and frontline staff to deliver more tests, checks, and scans, including urgent cancer referrals, level of pressure across the whole health and care system remains concerning. The total waiting list for planned procedures has hit another record, with over 7 million people now waiting for care. Yesterday's announcement of an Amber Alert by NHS Blood and Transplant for blood stocks, which could lead to some non-urgent operations being delayed, will pile on further pressure. Dr. Sarah Clark, president of the Royal College of Physicians, said, without a credible long-term workforce solution in place, we risk normalizing long waits and compromising patient care. Staffing shortages are the biggest barrier to cutting wait lists. The new Secretary of State has promised a long-term workforce plan. This needs to come by the end of 2022 and include how many staff will be needed to keep pace with demand now and in the future. Dr. Adrian Boyle, president of the Royal College of Emergency Medicine, added to the call for a longer-term plan and said the government needs to wake up. Urgent and emergency care system is under severe strain across the country. Multiple critical incidents have been reported at different sites, with more patients facing longer waits. We know long waits are associated with harm and even death. Staff are going above and beyond to ensure they are mitigating this harm and continue to deliver effective care. The reality, as we head into winter, is we have record numbers of 12-hour DTA waits monthly. A new record low for patients seen within 4 hours, record numbers of patients on waiting lists, large numbers of patients ready for discharge from hospital, and a shortfall of 13,000 NHS beds and over 130,000 NHS staff. Oh yikes! I'm sorry to hear. I hope. Well, the recommendation, as someone who's trained to work in a lab and has gone through multiple training, safety trainings, if you're able to, like, flush your eyes with copious amounts of water as much as you can. But I can only imagine that burns very bad. So, the government must face up to this reality and recognize that the system is failing patients and demands action. In the medium to long term, the government must deliver the fully funded long-term NHS workforce plan that they pledged to deliver and open 13,000 beds to drive meaningful change. Despite the increase in cancer referrals, Minesh Patel, head of policy at Macmillan Cancer Support, expressed worry about the new figures. Whilst it's positive to see an increase in cancer referrals, far too many people with cancer continue to experience unacceptable delays in accessing the care they desperately need. NHS cancer care is in crisis as we head into winter. As more and more people enter a cancer care system that is already struggling, the government must guarantee the NHS has all it needs to address the long-standing challenges cancer care has been facing, including significant staffing shortages. Pretty much one of the same fundamental issues that's also occurring in Canada. Just massive staffing shortages, and it looks like over in the UK, like in the NHS, virtually the exact same thing. Without extra funding, we are deeply concerned the situation for people with cancer is set only to go from bad to worse, as patients are once again left to pay the price. And as you can see here, and some recommended stories, further evidence. NHS forced to pay high rates for agency staff to make up for staffing shortages. Where again, this pretty much exactly mirrors what has happened here in Quebec. Where, yes, in Quebec, we have privatized certain healthcare, whatever, services. And a lot of nurses, understandably, have moved from, the public healthcare system to the private healthcare system. Because, the private healthcare system does pay better. It typically does have better conditions. And so, one of the ways that the Quebec government has attempted to address nursing shortages in the public healthcare system is by going to these private healthcare agencies and contracting the nurses out and putting them back in the public system. But what the government ends up doing is since they're contracting out from these private healthcare services, they can inflate their prices. So the government ends up overpaying these nurses to like bring them back into the public sector. Whereas, if they had just listened to the nurses, 15, 20 years ago, asking for higher salaries, they wouldn't have had to do that. Where it's like, yeah, now that it's like dire circumstances, now the government is willing to like literally overpay to get nurses back from the private sector back into the public sector. They could have just done that like over a decade ago. Super frustrating. So yeah, that pretty much like wraps up what I more or less wanted to touch upon in terms of like, my stream title and, healthcare and crisis in Canada. Where like, yeah, I am focused on Canada and Quebec, Canada. But this appears to be happening in very many places, not just Canada. Canada, UK, United States is having its own healthcare issues. That, again, maybe I'll cover on a future stream. But hopefully, covering something lighter, maybe more uplifting, or at least hopefully more uplifting. So, and this is maybe a little bit more geared towards Bob Marley, or at least this was prompted by Bob Marley, because I think they explicitly said that they don't really listen to music, or like they don't really place a lot of value in music, which doesn't necessarily surprise me. But maybe I can convince them otherwise. But there's research about music's effect on humans, and I think we're really only beginning to understand music's effect on human beings. Even though there's like some research out there, as far as I can tell, like there's not a lot of research out there. But so far, of the research that I've seen, it's pretty cool, first of all, and it's also like pretty positive, where it seems like we are almost like biologically wired to respond to music in a positive way. And this is just another piece of research that backs that up. This is published this year, whatever, and I don't know, 5-6 months ago, in May 2022. So, groove rhythm stimulates prefrontal cortex function in groove enjoyers. So, I'm not going to read the entire article, but probably just cover the highlights. Hearing a groove rhythm, which creates the sensation of wanting to move to the music, can also create feelings of pleasure and arousal in people. And it may enhance cognitive performance, as does exercise, by stimulating the prefrontal cortex. Hey, if music is able to turn people socialist, then like, yeah, totally, I'll make music recommendations for everyone. You just let me know the songs, and I'll start recommending them. I have my own socialist style of music, but I don't think it works on everybody. Here, we examine the hypothesis that groove rhythm enhances executive function by acting on the left dorsolateral prefrontal cortex.
Welcome to Flavor Country.
And Hyralian, I apologize if I mispronounce your username, but welcome. Thank you so much for the follow. Happy to have you here. And actually, I just noticed, I am now past 500 followers, which is mind-blowing to me, and I'm super grateful for it. Hyralian, I think you're 501, and I think who would have been 500 if it's Armand Bigsby is the 500th follower from Scott's community, Fabian Liberties, which I'm super grateful for. Grateful for the follows, and happy to have everyone here. So, where was I? Yeah, acting on the dorsolateral prefrontal cortex while also considering individual differences in psychological responses. It's like, yeah, yes, it does. At least it strongly hints that we are basically wired to respond to music But, clearly, oh, just about every person has unique musical tastes. And that, our musical tastes are clearly influenced by, our environment and, our psychological profile. And our psychological profile is influenced by our environment. And so, I think this is, to me, this is like a really psychologically interesting topic. Of like, what is the type of music that kind of like whatever touches your soul, as they say. And are we able to make somewhere down the road predictions about people based off of their musical tastes, right? As in like, if we're able to, if we understand music enough and how it resonates with us and how it affects us, or how our preferences are shaped by our psychological profiles, then if we know their musical tastes, are we able to say something about that person's psychology or their personality? As there's a little bit of research, not the greatest, showing that you might be able to like make some correlations between someone's musical tastes and their psychology, but basically that research is not that strong. But maybe somewhere down the road. 51 participants underwent 2 conditions: 3 minutes of listening to groove rhythm or a white noise metronome. Before and after listening, participants performed the Stroop task and were monitored for dorsolateral prefrontal cortex activity with functional near-infrared spectroscopy. Our results show that groove rhythm enhanced executive function. So this is just, whatever fancy terminology, kind of like higher order brain functions. And dorsolateral prefrontal cortex activity in participants who felt a greater groove sensation and a more feeling clear-headed after listening to groove rhythm. Further, these psychological responses predict the impact of groove rhythm on dorsolateral prefrontal cortex activity and executive function, suggesting that groove rhythm enhances executive function via dorsolateral prefrontal cortex activity when the psychological response to groove rhythm is enhanced. So it basically, it seems like, and I think it's built into the title, groove enjoyers, where if you enjoy this type of music, then there appear to be like some psychological or neurological benefits to you enjoying that type of music, which is like super interesting. So maybe just to read the intro a little bit. A growing amount of evidence shows that physical exercise has beneficial effects on cognitive functions, especially on human executive function, mainly in the prefrontal cortex. Our recent study using acute exercise with music showed that the key factor of exercise effect on prefrontal executive function is a positive affective response, expressed the two-dimensional axis of pleasure and arousal. Where it's like, we know we have more and more mounting evidence that exercise, not only just great for your overall health, but that includes your brain health and your psychological health. And now there's research coming out, or there's research that has come out that they're alluding to here. When you combine exercise with music, those beneficial effects appear to be enhanced. And actually, I dug up the research that they were referring to, or that they've conducted in the past, which is here. Positive mood while exercising influences beneficial effects of exercise with music on prefrontal executive function. Functional NIRS study. I'm not going to read this entire thing, but just cover the highlights. Exercise while listening to music elicited greater enhancement of positive mood. So we know pretty with a high degree of confidence that exercise, just like I said, not only has health benefits but has psychological benefits. Where it's appears to generally be pretty good at protecting you against anxiety, depression, and other sort of negative mental health issues. And it looks like, if you combine exercise with music, psychological benefits are even greater. Positive mood influenced the Stroop task-based executive performance positively. I hate this pop-up. The levels of positive mood also predicted prefrontal activation measured by functional IRS. Affective response to exercise is one influencer to the cognitive gain. So it's like, yeah, just again, it seems like this is something we are wired to enjoy. No, not only are we kind of like, say, in many respects, wired to enjoy or benefit from exercise, we are wired to enjoy and benefit from music. And it seems like if you combine the two, then the benefits are like almost like exponential or like further enhanced, which to me, super cool. And is just further justification for me to continue to work out with music. Another potential stimulus which can improve executive function through a positive affective response is groove rhythm. Groove rhythm is a musical rhythm that induces the sensation of wanting to move to the music. Groove sensation, accompanied by positive affective responses while listening to music. So this is, basically whatever technical terms for dancing. Wanting to move to the music. And like, yeah, there are many responses to music, and one of them appears to be whether we're wired for this. It does appear to be the case to a certain extent. Like, yeah, there's just like this desire for movement or for this desire for dance. Where does that come from? I have no idea. But there might be some psychological benefits to that that we're only now in the process of understanding. The groove sensation can be modulated by syncopation. Syncopation is a method of shifting rhythmic emphasis by manipulating the complexity of a rhythm. Rhythm with low to medium syncopation induces a higher groove sensation than does rhythm with high syncopation, as evidenced by averages of mass groups in previous studies. Low frequency components, such as the bass drum, induce entrainment of body movement and musical beat. In several previous studies, drum breaks, consisting of hi-hat, snare drum, and bass drum sounds were used because they made it easy to control rhythmic factors, syncopation, bass sound, and tempo. And Globus, welcome. Thank you so much for passing by. Shout out to Globus. Let's see if I can do that competently. Fellow streamer. I am doing well. I hope you're doing well. Right now, I am covering pretty much how music appears to have some beneficial effects on us. And that, like we are almost wired to enjoy music. And as I just mentioned, it seems like the combination of music with exercise just like super beneficial to us, which is highlighted here. Positive mood while exercising influences beneficial effects of exercise with music on prefrontal executive function. And not only does it appear to make us feel good, but like there are measurable positive effects on our brain, as they say. Positive effects on our executive function, basically those higher order brain functions, because that's one of the reasons why they carry out this Stroop task. Oops, spell it. Yeah. So the Stroop task, if I remember correctly, it's basically it's one of the tests that they kind of use to assess cognitive function. If I remember correctly. Trying to find the best way to describe it. But basically, again, this is going from memory, but I'm pretty sure I'm correct. One of the things that's part of the Stroop task, if not like, this is basically the test in a nutshell, is they'll give you the instruction of like identify the color of the word, where they'll give you kind of like a bunch of words identifying colors, and then you have to identify what the word is saying and not the color of the word. As in, they will like literally what'll appear on your screen is the word red, but it'll be in the color, the text will be in the color yellow, and you need to respond to the text. As in, you need to say this is red and it's not yellow, or something to that effect. And they're testing something specific there. But I want to double check that. I don't want to spreading, false information. Yeah. So I'm not far off. It's things like this. Where it's like, you got to read the words and ignore the color of the word. Where it's like, yeah, if this is the word blue in yellow, you like gotta say blue. Etc. etc. And it's a pretty robust test. I've actually done this test because I've volunteered myself for studies like these. And the test has multiple purposes, but one of the things kind of like sort of assessing some level of cognitive function. Where they're basically like testing how quickly you are to like identify what they're asking you to identify. Where it's like, yeah, when they have the color, when they have the word red on your screen, but the text is in yellow, how quick are you able to like identify it as the text is red and you're filtering out the information that the text is in yellow? On paper, it sounds like a simple test, but you'd be surprised. Yeah, it can kind of trip you up. And basically, if your cognitive function is being enhanced, okay, then generally speaking, there will be improvements in the Stroop test, where you'll be able to respond faster. When the word red pops up, but it's in yellow, you'll be able to identify quicker that it's the word red, and you can ignore that information that it's yellow. Or like when the text or the word blue comes up and it's in red, you can ignore that it's the color red, and you can identify that it's blue. That's sort of like the cognitive enhancement that you would be measuring. So where was I? Yes. I was here, right. Moving the body to music is a universal phenomenon. Clapping, nodding, swaying, and one of the main powers of music. Music with groove-inducing characteristics, increasing in recent music popularity charts, may be indicative of this. That groove music improves gait performance in Parkinson's disease by reducing the cognitive demands of synchronizing to the beat and promoting vigorous movement, shows that groove music affects the interaction between body movement and brain function. Where it's like, yeah, many people, make this distinction between, and I understand why they do, but for many people, mental health is in a different category than, physical health. But that's an arbitrary distinction, right? Because when people say mental health, they're talking about something at the level of the brain, right? And your brain is part of your body. It's physiological. And there's ever more increasing evidence that there's this dynamic interplay between what affects your body affects your mind, what affects your mind affects your body, and sort of what they're alluding to here, where it's like, yeah, just by moving to the music, there's these positive benefits for Parkinson's disease patients. And Kitty, welcome. Thank you so much for passing by, and totally a legit and valid criticism. Love you as well. But I guess, so I don't know for sure, since, I'm not deaf I can't speak to their experience. But I would suspect that deaf people can still respond to music, if like if they're able to like feel the vibrations, right? Where if it's like, you know, heavy bass music, you know, I'm really curious, and I have no idea whether that's been tested or not. But I still think deaf people potentially have the ability to respond music, where it might just be through feeling the music and not hearing the music. That would be my suspicion. And I understand, you know, you're making a joke, and I'm probably taking it too serious. But I still like to think about these things. More interestingly, listening to groove music induces entrainment of body movement and musical rhythm together with positive affective responses, and activates neural networks associated with motor and reward systems. Since the dopaminergic reward system projects not only to emotion-related brain areas, but also to cognition-related areas, such as the prefrontal cortex, groove rhythm could increase prefrontal cortex activity and lead to improved executive function. However, no research has explored the effect of groove music on executive function and prefrontal activity to date. The reason for this could be that the effect of groove rhythm on executive function may have large individual differences, because both groove sensation and concurrent positive affective responses to groove music would have many individual differences, and both responses are associated with reward system activity. Therefore, we should examine the single effects of groove rhythm on executive function and its relationship with prefrontal cortex activity. To examine this, consideration of the psychological responses to listening to groove rhythm as influential factors that explain individual differences, and creation of an experimental model which can evaluate the effect of groove rhythm on executive function and how it is related to prefrontal cortex activity are necessary. So like, yeah, basically they're just assessing groove rhythm music on executive function. That's actually a good point. Rhythmic visuals as well. I have no doubt they can almost, well, I'm pretty confident they'd be able to respond to that. You know, I think we're just like wired to respond to rhythm in so many ways. I'm obviously not going to dissect their data, since you know, I'm not the most qualified to dissect this type of data, even though I know what they're doing here, but rather play it safe and just get right to the main conclusion. They're obviously doing a pretty complicated analysis. Yeah, so the discussion. I just need to hydrate. So the purpose of this study was to determine whether groove rhythm enhances executive function and dorsolateral prefrontal cortex activity, focusing on individual differences in psychological responses to groove rhythm. So essentially, you know, they are selecting people that essentially like or enjoy groove rhythm music. To achieve this purpose, the current study tested the hypothesis that groove rhythm presented as drum breaks with low to medium syncopation enhances, I imagine this is Stroop task. I want to see what CWST stands for. Can't remember. Sorry. Right, yeah. Oh, okay, so it is the Stroop task. Yeah, color word matching Stroop task. I just wanted to be clear. Get off my screen. Go back to the discussion. enhances the Stroop task performance with task-related dorsolateral prefrontal cortex activation, and that the effects can be remarkable in participants who show higher groove sensation and positive psychological state. To our knowledge, this study presents the first experimental evidence for the enhancing effects of groove rhythm on executive function and dorsolateral prefrontal cortex activity in only participants for whom listening to groove rhythm largely augments both groove sensation and feeling clear-headed. In addition, these psychological responses to listening to groove rhythm were shown to predict executive function and dorsolateral prefrontal cortex activity. So first, as a precondition of the experiment, we confirmed that drum breaks with a low to medium degree of syncopation induced groove sensation, that is, wanting to move to the music, and positive affective responses, for example, having fun, excited. Compared with the... my instinct is to say this is working memory, but I don't think that's it. What is WM? Likely be at the beginning. Or not. I'm curious as to why they don't tell me what WM... not be difficult to find. Okay, well, whatever. I'm just curious, but I don't think it's critical to get the main message of the study. But generally, when I encounter the abbreviation WM, it stands for working memory. But I'm like almost 100% certain they're not talking about working memory. This agreed with previous studies showing that drum breaks with a low to medium degree of syncopation induce higher groove sensation. Yeah, totally. You know, obviously, I have no problems reading papers with abbreviations that are in my field, because, like, you know, that's second nature to me. But when reading outside my field, you know, yeah, I know dorsolateral prefrontal cortex because I've read a lot of neuroscience. I've read a lot of neuroscience literature, and I know EF as executive function. But obviously, every once in a while, I'm gonna encounter an abbreviation, or whatever, an acronym that, yeah, working memory. Like, I know that's an abbreviation for WM, but I know that it's not applying here. And yeah, it should not be that difficult to find out what this stands for. So, to make the rhythm more interesting to listeners and to thus induce groove sensation and the related positive affective responses, a balance between expectation and violation of the rhythm is thought to be important. This is supported by the hypothesis that prediction error, deviation from predicted rhythm, is a requisite for music to activate the reward system in the brain. Since the validity of our experimental design was confirmed, we proceeded to the detection of the effect of groove rhythm on cognitive function. So it's like, yeah, you know, like I said, it seems like we are like almost wired to respond to rhythm. And generally speaking, you know, we don't typically enjoy kind of like these violations in rhythm, where it's like, yeah, if the rhythm at some point, you know, doesn't go according to our expectations, you know, that typically annoys us. Or rather, we feel a greater sense of reward when, you know, we are kind of like feeling the rhythm, or like we're in the rhythm of the music. Whereas, like, as they're alluding to here, like it appears to like activate the reward system in the brain. Regarding executive function and dorsolateral prefrontal cortex activity, we confirmed that there was a Stroop interference in both Stroop task performance and dorsolateral prefrontal cortex activity. However, there were no significant differences between experimental conditions. One possible reason for this is extensive individual differences in psychological response to groove rhythm. Thus, we conducted a subgroup analysis to consider the influences of individual differences in psychological response. Using the K-means clustering method, in which good nori and feeling clear-headed were the variables, participants were divided into 3 clusters. The results show that only in participants who felt a high groove sensation and a high feeling clear-headed groove familiar cluster, listening to groove rhythm significantly enhanced executive function and dorsolateral prefrontal cortex activity compared to the WM condition, or I guess the control condition. So like, yeah, basically, when they pooled all of the participants together, they were not seeing a pronounced effect, or there was no statistically significant effect. However, when they filtered out, and, they selected for, kind of the people who were self-identifying basically as groove enjoyers, as in they respond to this music, they enjoy this music, it induces, good feelings, they listen to it, and they feel clear-headed. When they isolate those groups of individuals, and they compare the others, then it's like, oh, there is this significant effect, where it's like, yeah, for this select group of people, the groove rhythm music is like having positive benefits on their executive function, and obviously on their mood. A positive mood, I think, is a good benefit, or a good mood, positive benefit. Conversely, groove rhythm significantly decreased executive function in the participants who felt a relatively low groove sensation and a low feeling clear-headed. Interesting. Yeah, this is super interesting. So like, this is almost like further testament to like how, we might be just like wired to like respond to music either positively or negatively. Or like here they're highlighting how it's like, if they focus in on the people who pretty much like who dislike this groove rhythm music, it's almost like it is detrimental to their executive function. It's just like bad for their psychology, essentially. Furthermore, using path analysis, we detected a potential causal relationship between groove sensation, psychological state, dorsolateral prefrontal cortex activity, and executive function. The model described that groove sensation influenced both psychological state and dorsolateral prefrontal cortex activity, and that psychological state influenced executive function and dorsolateral prefrontal cortex activity. When interpreting neural activity, it should be considered together with task performance. With regard to improved task performance, neural activity may decrease, remain unchanged, or increase. A decrease or no change in neural activity, despite an improvement in task performance, can be interpreted as an increase in neural efficiency. Right. So I think they're touching upon something that I think is important, at least in my opinion. We're like, yeah, it appears to be pretty tricky in neuroscience. Or, well, this is not just isolated to neuroscience. But like, it's pretty tricky to, draw meaningful conclusions. Where it's like, just because you are measuring, or you are showing changes at the level of the brain, that doesn't mean that doesn't necessarily mean that there is any meaningful change at the level of, activity or behavior or cognitive performance. Where it's like, yeah, you can, put someone in an fMRI scanner and, whatever intervention that you're using, you might be able to show that, oh, in this area of the brain, there's decreased activity. And therefore, one might conclude that a decrease in, activity in a certain area of the brain, that means there might be some sort of like detrimental effect. But that is not necessarily the case, as they are alluding to here, where like, a decrease in activity at the level of the brain does not necessarily mean anything at the level of performance. Where it's like, yeah, someone can have the exact same, test on, have the exact same score on a cognitive performance test, and yet you might be measuring at the level of the brain, changes in their brain state, or changes in the activity in certain regions of the brain. And so, like, you really need to show that, like, whatever it is that you are measuring at the level of the brain is actually, correlated to whatever, cognitive test or psychological test that you're administering. Measuring changes at the level of the brain. Again, I'm not a neuroscientist, like, generally speaking, like, not all that meaningful per se, at least when it comes to cognitive performance. Because as they sort of allude to here, a decrease in activity, a decrease in neural activity, and just be the result of, greater neural efficiency. Yeah, welcome back, Bob Marley. So far, music is only detrimental if you are, like, consciously listening to music that you don't enjoy. So far in this paper, the people that enjoyed the music, they had pretty much, they benefited psychologically and cognitively, as opposed to the people that listened to the music that they did not enjoy, and, like, yeah, it appeared to be detrimental. Gender, task difficulty, and training are known to be influential factors of neural efficiency. On the other hand, if neural activity increases with improved task performance, it can be interpreted as an increase in neural activity to achieve higher task performance. Right. Like, you really need to tie the changes in the brain to some sort of task performance. Cannot just, like, stop at, like, oh, this change at the level of the brain, like, it means, you basically, like, you can only draw so many conclusions with that information alone. In the present study, increased dorsolateral prefrontal cortex neural activity was positively correlated with better group task performance, suggesting that the dorsolateral prefrontal cortex neural activity led to higher executive function. This interpretation has also been validated by other previous studies, including our own. These results suggest that groove sensation and psychological state are important predictors, and these factors influence the effect of groove rhythm not only positively, but also negatively. I would say, well, I don't know that we haven't answered that question, just because, like, I think that's, I'm not going to invalidate your experience, but, like, it's really hard to believe that, like, you don't enjoy any music whatsoever. But, like, I'll take what you say at face value. But it might just be the case that you just haven't found music so far. Like, I think it's also fair to say that you have not listened to every single piece of music in existence, and it may just be a matter of you haven't been exposed to the type of music that you would enjoy. The participants who were grouped in the groove familiar cluster experienced positive effects of groove rhythm on executive function and dorsolateral prefrontal cortex activity. Successful entrainment and body movement to a musical beat, rhythmic entrainment, sensory motor synchronization could be among the important factors for promoting the positive effects of groove rhythm. Generally, music induces positive affective responses and concurrently increases dopamine release and brain activation related to the reward system including the basal ganglia, midbrain, and orbital frontal cortex, whereas rhythmic entrainment reinforces both groove sensation and positive affective responses, and recruits brain regions related to both the motor and reward systems through basal ganglia activity, which plays a key role in the connection of rhythmic entrainment and positive affective responses. I've had a period of depression where all music, which I'm sorry to hear, and that makes sense. No, well, I mean, and that makes sense in the context of depression, where it's like anhedonia is very much a thing, pretty much like goes hand in hand with depression. Where it's like anhedonia, generally speaking, you don't derive enjoyment and pleasure from the things that you typically derive enjoyment and pleasure from. And totally, I can see music as being a part of that. Okay, well, that's actually reassuring. Because as alluded to in this article, and as alluded to in previous research, like, it seems like, okay, music, like, activates our reward system. Okay, and I think it activates our reward system for a reason. Because, like, there's, positive, psychological and cognitive benefits. Where it's like, yeah, it seems like, okay, I'm not gonna say for sure, but, it seems like, we're almost, wired to respond positively to music. And so, like, if you say that you don't enjoy any music whatsoever, it almost, like, hints at, like, I'm not in any way qualified to diagnose anyone with anything, except for, diagnosing, poor form on the squat, deadlift, bench, and a bunch of other exercises. That's about it. But pretty much if you're saying, if you don't enjoy any music whatsoever, you're almost, like, saying, like, yeah, my reward system, like, is just, like, might not be functioning optimally. Because, like, for virtually every other person, music, at least music they enjoy, activates the reward system. It would be almost like saying, I don't respond to, like, heroin. Everyone, well, not everyone, but, like, the overwhelming majority of people respond to heroin. In terms of, like, those feelings of whatever, euphoria. Whether they get addicted or not is a different story, and that's a separate subject. But at the very least, like, they still, virtually everyone responds to it, and, gets a positive reward from, like, opioids. That groove music recruits not only the reward system, but also the motor system, indicates that the body and musical entrainment are the basis of inducing a positive affective response. Yeah, I can totally see that. But at least for me, I can get lost in a song just as much as I can get lost in a film. I'm very much a music and movie enjoyer. Where it's like, I was practically raised on movies. I'm not saying that's a good thing. And that might be a testament as to why, whatever, I am the way I am. But totally, movies have very much shaped the person that I am. In addition to recruiting the dopaminergic reward system, high groove music also induces a physiological arousal-related... high groove music also induces physiological arousal related to the noradrenergic system, which is part of the catecholamine system. Neurotransmitter catecholamine, if I remember correctly. If I remember my neuroscience. Inducing brain activation. A positive affective response involving the catecholamine system can trigger the enhancement of executive function related to dorsolateral prefrontal cortex activity. Considering that both groove sensation and positive affective responses were together correlated with basal ganglia activity in a previous study, and that the current data shows that both groove sensation and feeling clear-headed are influential factors in the effect on dorsolateral prefrontal cortex activity and executive function, we could postulate a relationship between rhythmic entrainment, psychological responses, the catecholamine system, and prefrontal function. Thus, groove familiar participants may have achieved successively entrainment to groove rhythm, enhanced groove sensation, and positive psychological states, and the psychological response may have triggered the release of neurotransmitters, resulting in dorsolateral prefrontal cortex activation and executive function enhancement. Conversely, the participants grouped in the low-feeling clear-headed and groove unfamiliar clusters experienced no or negative effects of groove rhythm on executive function and dorsolateral prefrontal cortex activity. So like, yeah, this might be the category that you fall into, Bob Marley. Maybe. But they are not saying universally music. They are talking about a specific type of like music. They're calling it groove rhythm for a reason. Because this is like a very specific type of music. But yes, there are totally people that exist that will not like that particular whatever brand of music. And so like, yeah, they experienced no or negative effects on their executive function or dorsolateral prefrontal cortex activity. One potential inhibiting factor is low beat processing ability in those individuals. It is possible that participants who have a low beat processing ability were forced to pay extra attention to the beat while listening to the groove rhythm. So it's almost like they're saying like, whatever, these are defective or deficient music listeners or groove rhythm listeners. Where it's like, yeah, their processing power for groove rhythm isn't optimal. So they need to pay careful attention to the music, and understandably that will affect their level of enjoyment. This may have resulted not only in inducing failure to become entrained, but also in reduced mental resources, which limited attention, motivation, and cognitive performance. In the current experiment, the average scores for the beat processing ability test among participants in both the low-feeling clear-headed and groove unfamiliar clusters were relatively low compared to the participants in the groove familiar cluster, but not significantly so. Since the beat alignment test used in the current study was a simple battery test to evaluate beat processing ability, further studies using battery tests with higher sensitivity are needed to detect the influence of inhibiting factors. This study has several limitations. First, widespread individual differences in psychological responses to the rhythm were demonstrated in the current results. Not surprising. Again, we all appear to have our own kind of like unique tastes in music. Various potential factors, such as musical training experience, music reward sensitivity, beat processing ability, familiarity with groove music, dance, body morphology, and cultural background, could influence psychological responses to the rhythm. Though more than 50 students participated in the current experiment, the sample size was insufficient for conducting sub-analyses to seek the effects of these potential influential factors. Future studies should plan to compare the effects between participants grouped by these potential influential factors. Second, in the auditory stimulus, we used rhythm with a low to medium degree of syncopation as the groove rhythm stimulus and a white noise metronome as the control stimulus. We could control tempo, but could not control the type and number of sounds. Further studies are needed to try to detect the influence of other acoustic specifications by using different patterns for the groove rhythm and control stimuli. Third, in the measurement of the brain's neural activation, the current study focused on only cortical, specifically the dorsolateral prefrontal cortex activity. Welcome, Readsters. Thanks so much for passing by, and you are more than welcome to give my mother groove rhythm stimulus. And shout out to Readsters, fellow streamer. Check them out when they stream. When I used to listen to music, I only really listened to stuff where musicians did impressive things. What exactly do you mean by impressive thing? Like impressive guitar solos? Are you talking about like Lindsey Sterling, doing basically, acrobatics while playing the violin? We should use fMRI, or positron emission tomography to examine, or PET, to examine brain activity in broader and deeper regions that are involved with motor, reward, and cognitive systems, their networks, and released neurotransmitters. Good. In conclusion, Listening to a rhythm with low to medium syncopation, enhanced executive function, and dorsolateral prefrontal cortex activity in only groove-familiar participants, which supports our hypothesis. These results suggest that individual differences in psychological responses to groove rhythm are one of the key factors in predicting the effects of listening to groove rhythm on prefrontal executive function. This study raises the potential that groove rhythm can enhance human cognitive performance like exercise. Like, Bob Marley, if you don't listen to music, or if you don't find music that you enjoy, you might be missing out on some of the cognitive performance benefits of music. And as someone who appears to be, I don't know about obsessed, but who appears to be, who appears to desire to be, cognitively efficient, and, wants to perform efficiently, maybe music will allow you to, increase your, cognitive efficiency. Amazing wordplay. That makes sense. But I do find Lindsey Stirling pretty impressive. And yeah, you might have missed this, Bob Marley, but there's other research. Okay, so not only did I just show, that if you listen to music, if you listen to groove rhythm that you enjoy, there are cognitive performance benefits. And as I just covered briefly before, but just to reiterate the notion of the benefits of music, like, yeah, it looks like if you combine music with exercise, there is like this synergistic effect, where it's like, this might be maybe one of the reasons why exercise is kind of like a leisure activity for you, as opposed to you might feel exercise or working out is work for you because you are not getting sort of like these mood enhancing benefits, or like these arousal benefits. Because as this research shows, if you combine exercise with music, as they say, it's greater enhancement of positive mood. And I this is just an N of one of my experience of like, yeah, I totally enjoy working out, no music. I can work out in silence, no problem. And I've done that many times before. There definitely have been times where like I just wanted to focus on just me working out, focusing on movement, focusing on the exercise, and I didn't need music. But generally speaking, as you see in my workout streams, I totally incorporate music into my workouts. Because like, yeah, at least for me, myself, it totally enhances the workout experience. And I totally get a mood boosting effect when I listen to music and work out. And totally when I run, and I run a lot, and I'm now back to running a lot. Totally, I enjoy running alone, and I can totally run without music. Again, I've done it many times before. But totally, when I combine running with music, a whole other kind of like experience. And it totally like boosts and elevates my mood. And I think I've alluded to that many times before on stream, where it's like, yeah, for the past few months, up until like the last couple of weeks where I've gotten back to running, I had to take an extended break from running, from pretty much around April to October. I wasn't able to run. But like, yeah, I was unfortunately recovering from that, or dealing with that infection in my foot. I had to put running on hold. And totally, that had detrimental psychological effects on me. Because I totally rely on like running to, sort of like boost and elevate my mood. And when that was temporarily eliminated from my life, I totally felt a psychological effect of that. So maybe I'm just throwing the question out there, or just throwing it out there to you, Bob Marley. It might just be a matter of like, maybe you should explore some music that you can really enjoy. And maybe you can, I don't know if you listen to music while you work out now, but maybe it's just a matter of, maybe finding your groove with, working out and music. And that maybe you can turn working out into more of a leisure activity if you're able to reap the enhancements in mood that many people get from finding exercise with music. Just throwing that out there. So hopefully, I've maybe opened the door a little bit for exploring music, and maybe at the very least, respecting the arts like music. I think I've provided a scientific basis for the value of music, because it seems like we are almost wired to like respond to and enjoy music. So yeah, moving on to hopefully another sort of positive science news story. This was published just today, or whatever, 20 hours ago, where it looks like some pretty impressive research was published in regards to cancer treatment, or as alluded to in the title, a pretty big leap forward in tailored cancer medicine. So, people with untreatable cancers have had their immune system redesigned to attack their own tumors. And this is this is a strategy, or this is a large focus for cancer treatment. Of like, basically, one of the strategies is to hopefully get your own immune system to deal with the cancer. And in fact, that is actually built in to our immune system. Like, one of the key functions of a healthy functioning immune system is to basically, get rid of cancerous cells. And it's generally like pretty good at recognizing it, but just like any system, not perfect. And one of the hallmark features of cancer is its ability to evade the immune system. And one of the strategies that researchers are trying to employ is, trying to get your own immune system recognize cancerous cells, that it can, do its pretty much like built-in function. Because like one of the key features of our immune system is it basically acts as a surveillance system for cancerous cells. And if it detects a cancerous cell, it generally induces cell death, or apoptosis on that cancerous cell. But again, the system obviously does not work perfectly. But maybe, hopefully, at some point down the line, we will have the tools to, as they're sort of alluding to here, kind of like tweak the immune system, or engineer it such that, it can carry out its function more efficiently, or better, or in a more targeted fashion. So, the experimental study involved only 16 patients, but has been called a leap forward and a powerful demonstration of the potential of such technology. Each person had a treatment developed just for them, which targeted the specific weak spots in their tumor. It is too early to fully assess the therapy's effectiveness, and it is expensive and time-consuming. The work focuses on a part of the immune system called T cells, which patrol the body and inspect other cells for problems. And T cells, if I remember correctly from my immunology, they're called T cells because they originate in the thymus. And the thymus starts with T, and thus T cells. Just as B cells originate in the bone marrow starts with B, get B cells. They use proteins called receptors to effectively sniff out signs of infection or deviant cells that have become cancerous. Cancers can be tricky for T cells to spot. A virus is distinctly different to the human body, but cancers are more subtle because they are a corrupted version of our own cells. The idea of the therapy is to boost levels of these cancer-spotting T cells. It has to be tailored to each patient as each tumor is unique. This is how it works. The researchers scoured patients' blood for rare T cells that already had receptors which could sniff out their cancer. They then harvested other T cells that could not find the cancer and redesigned them. Their original receptors, which may find other problems or infections, were replaced with those from the cancer-searching T cells. Finally, these modified T cells were then put back into the patient to seek out the tumor. So it's it seems like, okay, so these patients, they had a, subset of T cells that it looks like they had the ability to recognize the cancerous cells. But it seems like, it wasn't enough of the T cells. And it seems like the patients also had a subset of T cells that did not have the ability to recognize the cancerous cells or the tumors. So it seems like what they did is they basically, they turned the T cells that weren't able to recognize into ones that are able to recognize. Transforming T cells into a form that can hunt cancer requires considerable genetic manipulation to both remove the genetic instructions for building their old receptors and give them the instructions for the new ones. Based off of what I know, not an easy task. It was made possible by tremendous advances in the gene editing technology CRISPR, which acts like a pair of molecular scissors, allowing scientists to easily manipulate DNA. Although I would say the word easily is doing a lot of work here. The researchers who developed CRISPR won the Nobel Prize for chemistry in 2020. Yeah, exactly. Your sentiment is exactly the same as mine. So the word easily is doing a lot of work. Maybe easily compared to what we had, 15, 20 years ago. Like I said, doing a lot of work. The trial involved people with colon, breast, or lung cancers that had failed to respond to other treatments. The study was designed to test the safety and feasibility of the technology and showed the modified cells were finding their way into the tumor. The disease continued to get worse in 11 patients, but stabilized in the other 5. However, it will take larger studies to work out the correct dose and how effective it really is. This is a leap forward in developing a personalized treatment for cancer, said Dr. Anthony Ribas, one of the researchers at the University of California, Los Angeles, who tested the approach developed by the company Pact Pharma. The results were presented at a meeting of the Society for Immunotherapy of Cancer and published simultaneously in the journal Nature. Dr. Manuel Juan, head of the immunology service at Clinic Hospital in Barcelona, said it was extraordinary work and undoubtedly one of the most advanced in the field. He added, "It opens the door to using this personalized approach in many types of cancer, and potentially in many other diseases." Professor Wasim Kasim was given life-saving designer immune system at Great Ormond Street Hospital, said it was a powerful early demonstration of what might be possible with newer techniques. Dr. Astero Klampatsa from the Institute of Cancer Research, London, said the study was important, but warned that the time, labor, and expense involved were huge. Yes, I believe it is. Second. If I remember correctly, okay. I could be wrong. I'm just going off memory, but I'm pretty sure I'm correct. So the cancer vaccine strategy, I believe, it's basically using viral vectors in order to target the cancerous cells, as in, you know. And the overall strategy is not all that much different. Where it's like, here, they are modifying T cells such that they're able to recognize the cancerous or tumor cells, as opposed to, again, if I remember correctly, the cancer vaccine approach is like they are basically like engineering viruses such that the viruses go on and infect, basically kill the cancers or tumor cells. I believe that's the strategy of the cancer vaccine. Not 100% certain. That's pretty deep in the filing cabinet of my brain. I want to double check that. Maybe I should just Google it. Oh yeah, people. Okay, well, I personally, well, in my PhD research, I work with largely bacteria. So basically not viral or human platforms. I'm mostly in most of my PhD work is involved in like basically modifying bacteria, expressing proteins, purifying proteins, running protein assays. Basically, you know, pretty hardcore biochemistry work. But in the company that I work for, we totally can't give too much away, because you know, some of it's basically confidential.
Welcome to Flavor Country.
But we basically do some work with viral platforms. Viral platforms as they apply to gene editing specifically. And also, thank you so much for the follow, Also Poser. Much appreciated. Happy to have you here. Yeah, well, to some extent, yes. Like, I can probably, like, reveal more information, but I'm trying to, like, play it safe. But, like, yeah. In our company, like, we totally do some, we work with some viral platforms for the purposes of gene therapy. So not in, like, the cancer vaccine stuff. Not really giving me the answer that I'm looking for. Okay, yeah. Right. So this is giving me the answer that I'm looking for. You can I guess view it that way. I don't think the bacteria view it that way because I'm not gonna lie. I am killing mountains and mountains of bacteria. You know, I don't hear their screams, but I don't think they're too happy about it. So I basically, if I'm their doctor, I don't think the bacteria like the way that I'm treating them. Where was it? Yeah. So they alluded to it here. Many classic cancer vaccines have utilized non-replicating viruses as vectors to express tumor antigens and or immune modulatory molecules. So it's like, yeah. Basically that appears to be, again, going from memory, and I don't think my memory is far off, because pretty much reiterating what I'm saying. Where it's like, yeah, one of the strategies of, you know, these, whatever, cancer vaccines in development is like, you know, to modify the viruses. I mean, we already do this with the vaccine technology, right? Well, with vaccine technology against other viruses, where it's like, we engineer the viruses such that, you know, they don't have any danger to humans. You know, we put a little, you know, package inside the virus, and we administer it to humans, and then the humans we give it to mount an immune response. Similar principle to some of the cancer vaccine strategy, where it's like, yeah, they'll use a non-replicating viruses as vectors. So this is basically, you know, vehicle of delivery to whatever the person, and it's non-replicating. So again, it pose no danger to the human that it's administered to. But then, you know, what we do is, you know, we put in a little package of, you know, a tumor antigen or immune modulatory molecules. Basically, you know, whatever package that we put into the viral vector, we hope that it, you know, stimulates the immune system such that, you know, now your immune system can do its job in killing the cancer or tumor cells. But I also do know that an active area of research is like engineering viruses such that, you know, the viruses themselves like go and target the cancer cells, right? Because, like, I mean, that's what viruses are essentially designed to do, right? I think everyone virtually knows this as a result of COVID, where, like, you know, I think everyone knows that, you know, COVID infects certain respiratory cells, right? And that COVID, through the spike protein, binds to ACE2, which is a receptor on certain respiratory cells in your body. And that's how it gains entry into your cells. And so, you know, on paper, you can hypothetically engineer a virus where it's like, you know, instead of it binding and infecting respiratory cells, you know, it binds and, you know, infects cancerous or tumorous cells. And there are totally, you know, legit and valid ways on paper to do that, because we know, okay, that, you know, there are many things that go wrong in cancerous cells. You know, whatever, a whole host of things go wrong in cancer cells. And one of the things that goes wrong is, like, you know, certain receptors, depending on the type of cancer, but like certain receptors can get upregulated, where like certain cancerous cells, they are expressing, you know, a whole host of receptors that are potentially unique to that cancerous cell. And so if you know that, you can potentially, okay, engineer a virus where it only binds to those unique receptors that the cancer cells or tumor cells display. Know that, and you can actually engineer that, and you know, on paper, you just have a virus that only infects and kills cancerous or tumor cells. And that would be kind of like, you know, a pretty ideal cancer or tumor treatment. Where it's like, yeah, instead of the virus, you know, infecting and killing healthy cells, like it's literally engineered to infect and kill cancer or tumor cells. Hypothetically, on paper, that is feasible and possible. And I do believe, if I remember correctly, that's an active area of research to do that. Okay, so you are posing totally a valid question and concern, for sure. And also, Kitty, you're totally bringing up another valid and legit concern, where it's like, yeah, as I said, a whole host of things go wrong with cancer cells, and obviously not every cancer is the same, but there are certain sort of like themes that apply to most forms of cancer. And you know, one of the hallmark features of cancer is something that you are alluding to, also poser, is that, you know, very often cancer cells, they basically, you know, have this feature of the ability to evade the immune system. This is one of the reasons why, you know, your immune system itself is not killing the cancer or tumor cells. It's because like the immune system is not recognizing it. But like, you are correct. Cancer cells do evade the immune system, right? And so, yeah, you are correct. They are not easily recognizable. But in principle, you know, you can potentially, and this is, I mean, that is exactly what they are doing in this research here that I just covered, where it's like, yeah, they literally re-engineered the T cells in these cancer patients such that they recognize the cancer cells. And so hypothetically on paper, you can do that with a virus as well. And yeah, that I totally take your point. That is also a challenge where, like, you are correct. A hallmark feature of cancers is like, yeah, patients, and that, you know, not like cancer cells are not this uniform thing that just perpetuates itself. Yeah, you're not wrong. Totally. But you can see here in this research, like, it's not an insurmountable hurdle to overcome. Not that this is easy research, right? This is like groundbreaking research, but requires a huge amount of like resources dedicated to it. And I tracked down the original research, which is right here. You know, kind of hot off the press. And like, yeah, this is like highly advanced technical research. You can see here, just in the link, this is a 73-page research article. And you can even see here, just in the list of researchers involved, you know, it just takes a huge concerted effort to produce research and outcomes like this. Right? I'm not saying this is like an easy thing, where it's like, you know, you just have like, you know, one scientist in the lab and like, you know, you can solve this challenge. But it does not appear to be an unsolvable problem. Like you are correct, totally, 100%. But I think that's just a challenge, and it's not an impossibility. And I think that this research bears that out. where it's like, yeah, they basically turned the unrecognizable cancer cells into recognizable. And I'm reasonably confident that can be employed, or that can be a strategy that can be employed through multiple avenues, not just engineering T cells. Like I mentioned, I'm pretty sure the virus strategy might potentially be employed somewhere down the line. I'm not going to read this entire research article because it's just so long and technical, and like this is just like this is a mountain of experts working together, collaborating to produce research like this. So like for me to like dissect research like this, I'm not qualified to do that. Okay, so there's a little bit of nuance there. So like on paper, okay, we can potentially do gene therapy on a living person. Now, is that something that's regularly done today? That's routine? No, because like basically gene therapy as a treatment for human diseases and conditions is in its infancy. I have a little bit of research. But I'll cover the research in a bit. I want to get through this. So for this specific research, okay, they are technically not doing gene therapy on a living person. Because what they did is they harvested the cells, certain cells, specifically certain T cells from these cancer patients. They genetically engineered those cells, okay, and then they put them back into the patient. So, basically, on the whole, the patient themselves, they basically were not subjected to gene therapy. Just a certain population of cells that were extracted, edited outside of the patient, and then put back into the patient. So, you know, is that gene editing of a living person? I would say no. You know, if you squint hard enough, you can kind of like potentially make the argument that this person was subjected to gene therapy. But there is research, and there are patients who have been explicitly subjected to gene therapy. And this was pretty landmark research, you know, published in the New England Journal of Medicine. It's like one of the most world-renowned, well-respected medical journals in the world. Where it's like, yeah, for the purposes of treating sickle cell disease and beta thalassemia, some patients have had their, you know, genomes edited, which I will cover after sort of like briefly going for basically this summary paragraph. Yeah, like I can totally, again, see that, but I think to, you know, most gene editing experts, they probably would not consider it like, you know, gene editing of the patient. So the T cell receptor provides the fine specificity of T cells to recognize mutations in cancer cells. We developed a clinical grade approach based on CRISPR-Cas9. I don't know why the text is all messed up here. non-viral precision genome editing to simultaneously knock out the two endogenous T-cell receptor genes, TCR alpha and TCR beta, and insert the track locus, the two chains of a neoantigen specific to TCR, neo-TCR, isolated from the patient's own circulating T cells using a personalized library of soluble predicted neoantigen HLA capture reagents. So like they say here, they isolated a certain population of T cells from the patients, from these 16 patients. 16 patients with refractory solid cancers received up to 3 distinct neo-TCR transgenic cell products, each expressing a patient-specific neo-TCR in a cell dose escalation, first in human phase 1 clinical trial. One patient had grade 1 cytokine release syndrome and 1 grade 3 encephalitis. This is basically, if I remember correctly, some inflammation at the level of the brain, or in some certain region in the brain. All had the expected side effects from the lymphodepleting chemotherapy. 5 patients had stable disease, and the other 11 had disease progression as best response on therapy. Neo-TCR transgenic T cells were detected in tumor biopsies post-infusion at frequencies higher than the native TCRs pre-infusion. So this study demonstrates the feasibility of isolating and cloning multiple T cell receptor recognizing mutational neoantigens, the simultaneous knockout of the endogenous T cell receptor, and knock-in of the neo-TCRs using single-step, non-viral precision genome editing, manufacturing of neo-TCR engineered T cells at clinical grade, the safety of infusing up to 3 gene-edited neo-TCR T cell products, and the ability of the transgenic T cells to traffic to the patient's tumors. So pretty much just reiterating what I said in a way more technical fashion. But taking a certain population of T cells, editing those T cells such that they're able to recognize the cancerous cells, and then just putting them back in the patient. And it seems like there's a pretty high rate of success. Not perfectly successful, since it doesn't seem like all the 16 patients bonded. But overall, this appears to be a pretty high positive response rate. So, when it comes to, I guess, more invasive gene editing, that has, totally occurred. It's still not routine for understandable reasons. It's like the technology, pretty fickle. And they're totally basically not a perfect technology. And not quite ready for prime time. We got to be really careful on how we implement this technology. When I hear gene therapy, I think in situ cells over an entire tissue organism. Yeah, that's fair. And I would pretty much say have the same mindset. So, CRISPR-Cas9 gene editing for sickle cell disease and beta thalassemia. So these are essentially, this is kind of like iron transport or iron storage disease. And this is basically a blood disease to a certain extent. Essentially misshapen blood cells. It's in the name. Sickle cell disease, because their blood cells take on this sickle cell shape. So, transfusion-dependent beta thalassemia and sickle cell disease are severe monogenic diseases with severe and potentially life-threatening manifestations. BCL11A, a transcription factor that represses gamma globin expression and fetal hemoglobin in erythroid cells, to just fancy terminology for blood cells. We performed electroporation of CD34 plus hematopoietic stem and progenitor cells obtained from healthy donors with CRISPR-Cas9 targeting the BCL11A erythroid specific enhancer. Approximately 80% of the alleles at this locus were modified, with no evidence of off-targeting editing. After undergoing myeloablation, 2 patients, one with transfusion-dependent beta thalassemia and the other with sickle cell disease, received autologous CD34 plus cells edited with CRISPR-Cas9 targeting the same BCL11A enhancer. Yeah, exactly. And also, welcome, Noda Bud. Always happy to have you here. I hope you're doing well. And yeah, you are absolutely correct. A red blood cell specific. More than a year later, both patients had high levels of allelic editing in bone marrow and blood, increases in fetal hemoglobin that were distributed pancellularly, transfusion independence, and in the patient with sickle cell disease, elimination of vaso-occlusive episodes. And funded by CRISPR Therapeutics, whatever, no big surprise, and Vertex Pharmaceuticals. So it's like, yeah, you know, I would say, well, like I said, this was published in the New England Journal of Medicine for a reason, because like this is where, you know, the patients themselves were subjected to this gene editing technology, specifically in the form of CRISPR-Cas9. And also, you know, yes, it seems like whatever, CRISPR-Cas9 is like whatever in the public consciousness. And, you know, when people think of gene editing, or when the general public thinks about gene editing, they think of CRISPR-Cas9 because, you know, that's potentially the most powerful and the most widely utilized. But there are multiple ways, or there are multiple technologies that can be potentially used for gene editing. One of them, falling out of fashion, but called TALENs. That just like CRISPR stands for something, TALENs also stands for something. It's a long acronym. I can't remember it offhand. It's right here. Transcription activator like effector nuclease. So like, yeah. Genome editing systems. Or like, yeah, CRISPR gets all the attention. Because like, yeah, whatever, the most powerful. But TALENs are also can potentially be used for gene editing. But understandably, people are leaning towards CRISPR-Cas9 because you know, this one has, you know, CRISPR has some challenges and hurdles to overcome before we can use it routinely on humans. But TALENs have like even more challenges and hurdles to overcome before it can ever be used for routine use in humans. Which is why, you know, people are going towards CRISPR because like the barrier to entry is lower. But there is also AAVs, or adeno-associated viruses, which is, I would say, is a very active area of research for the purposes of gene editing, where it's like, again, CRISPR gets all the attention, but it's not the only thing out there for gene editing. And AAVs are also potentially somewhere down the line may be in use for gene editing. I lost a lot of faith in the government and government healthcare since COVID. Yeah, I totally don't blame you. I mean, just earlier in the stream, I was covering how, you know, Canada's healthcare system. Well, it's in my stream title, right? Canadian healthcare in ruins. And so I don't blame you if you have lost faith in government-run healthcare. Definitely, I would say, you know, my faith in government-run healthcare has been, you know, shaken because, like, I covered it earlier. Oh, it seems like it's on the brink of collapse, or it's already there. And it seems like it's, you know, it's only going to get worse before it gets better. You know, that's not a good thing. So yeah, I don't blame you at all, Notable. Oh, and also Zero Ohms, welcome, or welcome back, I should say. Nice to see you again. Did you see we spent like 96 billion on this? What? This seems to be straight from NASA. Do probably zoom in. I not know how to zoom. There we go. A NASA technology that could one day help land humans on Mars is heading into final testing before a flight test later this year. The Bernard Cutter Low Earth Orbit flight test of an inflatable decelerator, LOFTID, Lofted, is scheduled to launch with NOAA's JPSS-2 polar orbiting satellite in fall 2022. After hitching a ride to space aboard a United Launch Alliance Atlas V, Lofted will inflate and then descend back to Earth from low Earth orbit to demonstrate how the inflatable heat shield can slow down a vehicle to survive re-entry. The Lofted flight re-entry vehicle is comprised of several segments. The forward segment connects the inflatable heat shield to the inflation. Well, this is all just technical stuff. Is this? Oh, this is a 1-minute video. Watch it. Oh. No sound, but that's okay. Seems like this is just the building process. Sped up version of the building process. I mean, yeah, 96 billion, at least, well, obviously, I'm not a NASA scientist or engineer, so, you know, I can't really speak to, you know, it's hard to judge technology like this, right? Because, like, I agree with you, on the surface, if in fact we spent, and I believe you, obviously, trust you, that, like, 96 billion based off of this description, like, I don't know if that's, like, the best use of resources. But, like, for all I know, this technology has some sort of, like, alternate use that I just can't think of. That, like, maybe it'll, like, revolutionize something else. I don't know. I'm trying to give the benefit of the doubt. But, like, yeah, that seems like basically a lot of investment for what seems like, admittedly, my very limited knowledge of things like this. Like, we're not getting the best bang for our buck with that money. I think a lot of it stems from the cost of living. I'm curious as to what exactly you mean. I assume you're specifically referring to the ever-increasing cost of living, which is, you know, draining virtually everybody, I guess, except for the ultra-wealthy. Like, totally, I have noticed my grocery bill has been inflated by inflation. Where it's like, yeah, you know, what I used to spend on, like, a month's worth of groceries, like, I'm spending it like 2 or 3 weeks, probably more closer to 2 weeks. And, like, you know, before, you know, I don't think I have expensive tastes, but before, when, you know, I go to the grocery store, this is whatever, I pretty much, like, virtually always buy the same things. And like I just never had to take into account, oh, this thing cost this much. Like I virtually never looked at the price of anything that I bought, just because like, you know, pre-pandemic it always cost the same, give or take whatever, I guess a few pennies. And now it's like, oh, every once in a while I need to be more conscious with my grocery spending, where it's like, oh, actually I was not expecting to spend this much. This is totally not what I was spending for the same items 3 years ago. There are YouTube videos with launch. Just wonder if you heard about. Oh no, like, so I very much appreciate that you post the source. Like, believe me, there is no greater source, or like, totally, it's a source of frustration for me when, you know, someone makes a claim or, you know, is alluding to a story, but they don't post the original link. Like, all the credit to you, Zero Ohms, that you posted this original source or article. I would say more people need to follow in your footsteps. I commend you for that. They're supposed to be able to attach instruments or, say, robotics to it. Well, I guess if they're able to do that, I guess that's definitely a potential, like, really great use. I sort of get it, sending anything to space and the materials needed to survive over there probably cost a lot, but when you see 96, yeah, exactly. Like, so, you know, to me, you know, as a scientist, you know, I am all for, you know, research and knowledge for the sake of knowledge. And I totally see the value of, you know, space exploration and developing things for space exploration. But like, you know, I'm not so sure of like the goal of going to Mars. I'm not sure if, you know, I don't know that we need to invest heavily or like spend disproportionate amounts of money on the goal of going to Mars. I don't think, as of right now, that's like the most lofty goal. Would it be cool if we went to Mars? Like, for sure. But do I think whatever it costs to send people to Mars, I think that money can probably be spent better elsewhere. I think. So, moving on to, you know, some more science news. Need to get a bigger bottle so I can fill it up with more water. Now I'm out. But and this also goes out or is inspired by Bob Marley, because, you know, they're questioning the value of mindfulness meditation for themselves. Absolutely, I've heard of sarcoidosis, an autoimmune condition. If I remember correctly, it affects the lungs. And yeah, there's a distinct inflammatory process. And they don't know what causes sarcoidosis. But totally, I am familiar with that condition. Not to be too arrogant, but I'm familiar with, I think, just about every autoimmune condition or inflammatory condition that's out there, just because, like, I have one, and I make it a point to familiarize myself with just about every autoimmune condition. And well, I want to make sure that I okay, so I'm not. Oh yeah, I was confident, but, you know, I want to make sure that I'm not just spreading BS. And have a lovely evening, Noda Bud. Thank you so much for passing by. And, you know, I'm definitely not going to sing the praises of Justin Trudeau. I don't think he's the worst. I definitely think he's far from the best. But I don't know that I go so far as fashy. But yeah, maybe a fashy. I could see that. But thanks again. Definitely though. Okay, well, I guess we'll have to debate that another time. But I wish you well, and thanks so much for passing by. But yeah, I always want to like double check. You know, I want to make sure that I'm not spreading, or I'm just not just talking and spreading BS. But like yeah. Sarcoidosis is characterized by growth of a tiny collection of inflammatory cells in any part of your body, most commonly the lungs. Yeah. But yeah, I think I was pretty spot on. Because like, well, I remember reading the Wikipedia article of this, whatever, like 10 years ago. I think I've read just about every Wikipedia article on just about any autoimmune condition or inflammatory condition that exists. I'm very sorry to hear, and my heart goes out to you. Because like, yeah, even though if I remember correctly, for many sarcoidosis patients, well, just like for many autoimmune conditions or just chronic illnesses in general, like it's a spectrum. You know, for some people, it can just be you know, a mild inconvenience, or they have like, you know, an initial flare-up, and then, you know, once that initial flare-up has subsided or it's treated, you know, the condition like goes into remission, and sometimes it can remain in remission for, you know, decades, years, or they just have that initial bout, and then for whatever reason it doesn't reoccur. As opposed to like, yeah, for some it can be like very debilitating. They have multiple flare-ups, or like they have multiple periods of relapse and remission. And yeah, I'm very sorry to hear that. If it's more on the debilitating or disabling side, for sure. Obviously, I cannot fully empathize with you because I don't have that condition and I don't know your experience. But as someone who has a pretty severe form of Crohn's disease, like I don't think I'm completely divorced from your experience. And at the end of the day, suffering is suffering. And I'm super sorry to hear that. I'm hoping you can get, you know, adequate and effective treatment. And if I remember correctly, well, since sarcoidosis is an inflammatory condition, and if I remember correctly, some of the treatments that they use for sarcoidosis also overlap with whatever Crohn's disease and many other inflammatory conditions. I mean, whatever. One of the staples, or like one of the most common treatments for any sort of inflammatory or autoimmune condition is, you know, just corticosteroids or prednisone, etc., etc. And I know sarcoidosis, totally, depending on the severity, very often prednisone, you know, one of the go-to treatments. Yeah, well, that makes sense. I have totally been on prednisone like countless number of times. I've had just about every form of prednisone that you can think of, mostly in the form of tablets, those awful tasting tablets. But I've had to add, you know, prednisone pumped into my veins. Just because, like, for whatever reason, the oral tablets weren't working. And yeah, and you know, unfortunately, I know that, well, you know, just about every disease and condition is under research. But, you know, since sarcoidosis is fairly rare and is not widely recognized, it is, you know, the research on sarcoidosis is underfunded. Well, I would say very heavily underfunded. Just because, like, yeah, it's unfortunate. it's sad to say that whatever the market drives research, and since there's not a huge market for sarcoidosis, the condition doesn't get the research dollars that it should get. Yep, that and I definitely have some wild memories of prednisone. Like it is, I think for many people, myself included, prednisone is a love-hate relationship, where it can make you feel great, but all of the other side effects that come along with it, for many people, myself included, the increased hunger, the insatiable hunger. I get just like terrible insomnia whenever I'm on prednisone. Like it is just, I'm not sleeping, but it's like a living nightmare. Just I can't sleep, no matter what, until like whatever, I've gone like 72 hours without sleep, and I just like I need to collapse. And like I avoid that. I avoid prednisone as much. Well, everyone does, but like each time that I've been put on it, like, or when my gastroenterologist makes that recommendation, it's like, listen, you need to take this, even though like he knows that like I just absolutely hate it. Yeah, totally. And prednisone totally can mess with your blood sugar. And at least for me, when I was younger, whatever, the increased hair growth and just like a bunch of crazy things that happen with your body, I get some pretty debilitating joint pain on prednisone, where it's like, yeah, I already get joint pain from the disease itself anyways, and just like I just get more joint pain on high doses of prednisone. And yes, I think I do remember reading that's how Bernie Mac died. And yeah, totally. I've definitely in the past, when I've been put on high dose steroids, like I just not only just the increased weight from all the eating, but the swelling, that classic moon face that occurs. Like I totally experienced that as well. And yeah, when I, thankfully it hasn't happened in a while, but when my disease had flared up last, and my gastroenterologist was saying like, hey, we need to give you a short treatment of steroids. I'm like, yeah, you just better give me like the lowest like livable dose, where it's like, yeah, it's just enough to like have some sort of effect, or it's like, yeah, I'm just like a little bit less miserable. That's like as far as, unless like I'm in really dire circumstances, like I just will not take high dose steroids, just because like, yeah, I don't want to put my body and brain through that, and its effect on your bones, definitely increased risk of osteoporosis, increased risk of potentially inducing diabetes, well, temporarily. And yeah, totally, I take your point. I would just say, I would probably expand it to just like the chronic illness community. Like I would say the chronic illness community is pretty resilient. And I'm generally pretty actively involved in the chronic illness community, and I will always advocate as best I can for the chronic illness community. Just because, like, yeah, the challenges that they face, I think I know them decently well. Obviously, I don't have a full understanding because I have my experience. I think I have some insight. And yeah, well, on the topic of self-coping. I think this article is pretty apt or fitting. We're like, yeah, mindfulness meditation program as effective as antidepressant for treating anxiety. And totally, you know. If you look at the data of patients who, you know, suffer from an autoimmune condition or an inflammatory condition, or just expanding to those with a chronic illness, period, they generally have, you know, higher rates of anxiety and depression, and understandably so. Just because, like, yeah, they face certain challenges that just, you know, affects their quality of life. And, you know, if you look at the rates of anxiety and depression of specifically Crohn's disease patients, it's like, you know, pretty much way higher rates in comparison to the general public or the general population. Where it's like, yeah, Crohn's disease patients generally, you know, depending on the data that you look at, they suffer from anxiety and depression at like 3, 4, 5 times the rate of the general population. So, anxiety disorders impact millions of people worldwide. Treatments for anxiety disorders include medications and psychotherapy. Although effective, these options may not always be accessible or appropriate for some people. Preliminary evidence suggests that mindfulness may reduce anxiety symptoms, yet no study has examined how its effectiveness compares to antidepressant medication used to treat anxiety disorders. Now, a first-of-its-kind study has found that mindfulness-based stress reduction, MBSR, is as effective as the antidepressant escitalopram for reducing anxiety symptoms. And I think this is Celexa? Or Celebrex? Nope, that's definitely not. So that's that's basically whatever. I should probably just Google. Okay. Okay, so I'm not far off. So citalopram, as opposed to escitalopram. So that is whatever. Okay, yeah, Lexapro. That makes sense. This is the structure of escitalopram. What was the structure of citalopram? Okay. Okay, yeah. For its S and antibiotic. I'm getting on a tangent. On organic chemistry. Like, yeah. Escitalopram is the mirror image of citalopram. Oh, whatever. Yeah. I know what that is. The researchers suggest that their findings provide evidence that mindfulness-based stress reduction is a well-tolerated and effective treatment for anxiety disorders. Anxiety is a natural emotion triggered by fear or worries about perceived danger. However, when anxiety is severe and interferes with daily functioning, it may meet the diagnostic criteria for an anxiety disorder. Data suggests that anxiety disorders impacted around 301 million people worldwide in 2019. This is almost like the entire equivalent of like, this is the equivalent almost of the entire population of the United States. Like, I think the current population of the United States is like, whatever, 330, 340, 350 million. Like, yeah, just imagine. Like, it's almost like just imagining like the entire population of the United States having an anxiety disorder. Treatments for anxiety include medications and psychotherapy such as CBT, cognitive behavioral therapy. Although they are effective, some people may not be comfortable with or lack access to these options, leaving certain individuals living with anxiety searching for alternatives. According to a 2021 review of research, preliminary evidence suggests that mindfulness, specifically mindfulness-based cognitive therapy and mindfulness-based stress reduction, may positively impact anxiety and depression. Still, it is unclear whether mindfulness-based therapies are as effective as medication for treating anxiety. Now, a new randomized clinical trial from Georgetown University Medical Center found that an 8-week guided MBSR program was just as effective for reducing anxiety as escitalopram, brand name Lexapro, a common antidepressant medication. This is the first study to compare mindfulness-based stress reduction with a medication for the treatment of anxiety disorders. Study author Dr. Elizabeth Hogue, director of the Anxiety Disorders Research Program and associate professor of psychiatry at Georgetown University Medical Center, Washington, D.C., told Medical News Today. This study was published on November 9th in the journal JAMA Psychiatry. Wonder if I can get the full article. Doesn't look like it. Comparing the mindfulness-based stress reduction and escitalopram, scientists from the Georgetown University Medical Center recruited 276 participants between June 2018 and February 2020 to conduct the randomized clinical trial. The participants were 18 to 75 years old, averaging 33 years of age. Prior to the start of the study, they were diagnosed with one of the following anxiety disorders: generalized anxiety disorder, social anxiety disorder, panic disorder, agoraphobia. I remember correctly, this is just like a fear of being out in public. Refers to, yeah. Open or constant. Okay, yeah. Crowded or enclosed spaces. The research team used a validated assessment scale to measure the participants' anxiety symptoms at recruitment and divided them into two groups. One group took escitalopram and the other participated in the mindfulness-based stress reduction program. Mindfulness-based stress reduction is the most widely used studied mindfulness intervention and has been standardized and thoroughly tested with good results, Dr. Hogue explained. MBSR instructors teach mindfulness in a group-based, face-to-face class using a variety of guided meditation exercises such as breath awareness, body scan, and gentle movement meditation, and also contains group discussions and question and answer periods. MBSR consists of weekly 2.5-hour-long classes, a day-long retreat, weekend class during the 5th or 6th week, and 45-minute daily home practice exercises. The home practice is guided meditation with audio recordings. When the 8-week trial ended, 102 participants completed the MBSR program, and 106 took the medication as directed. After the research team re-evaluated the participants' anxiety symptoms, they found that both groups experienced an approximate 30% reduction in the severity of their symptoms. Considering their findings, the study authors suggest that MBSR is a well-tolerated treatment option with similar effectiveness to a commonly used medication for anxiety disorders. Why was MBSR effective for treating anxiety? A previous 2021 longitudinal study found that mindfulness predicted lower levels of depression, anxiety, and social impairment in people working in emergency rooms. These positive effects were strongest for anxiety, followed by depression and social impairment. Yeah, and it's interesting, at least to me it's interesting, that the benefits of mindfulness extend beyond just anxiety and depression. Where it seems like, what exactly does social impairment mean? I don't know. But the fact that, however they're classifying social impairment, they are finding a positive effect on social impairment. Pretty cool. I think is a testament to mindfulness-based interventions. Yes, yet it remains unclear why mindfulness is effective at reducing anxiety. We think that mindfulness-based stress reduction might have helped with anxiety because anxiety disorders are often characterized by problematic habitual thought patterns such as worry, and mindfulness meditation helps people experience their thoughts in a different way, Dr. Hogue said. In other words, mindfulness practice helps people see thoughts just as thoughts and not become over-identified with them or overwhelmed by them. MBSR versus other mindfulness techniques. MBSR is not the only mindfulness approach used in therapy. Other types include mindfulness-based cognitive therapy. Similar to MBSR, this approach uses the same basic structure, but focuses on the negative thinking patterns associated with depression. And DBT, or dialectical behavioral therapy, This type teaches mindfulness, distress tolerance, interpersonal effectiveness, and emotional regulation. Acceptance and commitment therapy. This intervention focuses on increasing psychological flexibility through acceptance and mindfulness combined with commitment and behavior change strategies. Peggy Liu, a licensed psychologist in New York City and director at the Manhattan Therapy Collective, told Medical News Today, "There are many types of mindfulness interventions for anxiety, but I frequently use ones that help someone focus on their breath and body so they can slow down and subsequently manage their anxiety successfully. I also differentiate mindfulness from relaxation strategies with my therapy patients." Liu explained that mindfulness is a precursor to addressing anxiety through relaxation strategies, because if you're not aware of how anxiety is affecting you, you won't respond helpfully. I use diaphragmatic breathing, body scanning, and grounding via the five senses. They definitely can be as effective as medication when done correctly, because they impact the part of your nervous system responsible for the fight or flight response. Implications for people living with anxiety. For people looking for anxiety treatments other than medication or psychotherapy, the study results support mindfulness-based stress reduction as a possible option. Based on the findings from this study, doctors can recommend MBSR as a possible treatment strategy for patients with anxiety disorders, which seems to work as well as an antidepressant. Also, the study findings would support insurance companies' reimbursement for MBSR so that patients don't have to pay out of pocket, given that MBSR is similar in effectiveness to the drug. They do pay for it, yeah. So I think this is, it's a little bit strange or whatever, a testament to whatever, our perverse healthcare or insurance system, where it's like, yeah, where it's given that you are literally demonstrating that this is just as good as, a medication, then they're pretty much, I don't think there's any reason why the insurance deny you, right? Because it's pretty much an equivalent treatment, and this should just be, part of a treatment strategy. You don't always have to go the medication route. In fact, depending on the circumstance, it may very well be like highly preferential to avoid the medication route. And so it's like, yeah, if this research is a testament to the effectiveness of MBSR and it being the equivalent to a medication, like, yeah, why should it not be paid for? What if your anxiety is squelched? A valid question. And welcome, Thrasha46. Happy to have you here. I hope you're doing well. Still, the study has some limitations. For example, the participants were predominantly females with higher education levels. Moreover, participant recruitment was limited to 3 urban academic medical centers. Furthermore, Dr. Hogue noted that the study did not test other medications used for anxiety. Since other antidepressants are similar in efficacy to escitalopram, it might be the case that MBSR is as effective as other medications. According to Dr. Hogue, future investigations may include determining what individuals benefit more from MBSR or medications. We can also look at different variables such as psychological factors or age to determine whether we can see what kind of people are more likely to benefit from MBSR versus benefit from an antidepressant, so that doctors can help patients decide what treatments to try. While the new research supports mindfulness as an effective treatment option for people living with an anxiety disorder, those considering MBSR to help them cope with their symptoms should talk with their healthcare professional to determine if it's right for them. I don't know that. I'm not familiar. So this looks like the original study. Well, it is the original study. Let's see. In this study, mindfulness-based stress reduction was a well-tolerated treatment option with comparable effectiveness to a first-line medication for patients with anxiety disorders. And like, yeah, this was a randomized clinical trial. So, pretty high quality evidence. 8 weeks. Reiterating the same thing. So yeah, I think this is very cool research. And hopefully, just more and more research comes out. And also, hopefully, more and more research comes out. Maybe showing other benefits to mindfulness meditation. I don't think, no for sure, but I don't think the benefits of mindfulness meditation are only applicable to anxiety and depression. As it's sort of alluded to in the article, it seems like, improvements in social impairment are also found. And there's totally research that I probably should dig up showing that, mindfulness meditation has a whole host of other benefits that it does not necessarily have to be reserved for the treatment of like some sort of diagnosable condition. Just as, you don't need to, suffer a heart attack. Hopefully inspire you to like go to the gym and lead a healthier lifestyle. I don't think you need anxiety or depression in order to adopt the practice mindfulness meditation, because benefits are quite clear. And well, I do want to cover this, but I don't think I want to cover it now. Pretty long article. I've been streaming for 3 hours, and I streamed for 2 hours earlier today. So overall, I think about 5-6 hours of stream time in total. So I think I gotta call it quits here for the night, fortunately. As well, I want to get up early to go to the gym tomorrow. So let's see if I can look to raid someone. I think I'm gonna look to raid Didier. Set that up. So yeah, I want to thank everyone that has passed by. Thrasher46, always a pleasure. Thank you, Zero Ohms, always a pleasure as well. Thank you, Noda Bud, Bob Marley, Kitty. I know I'm missing a bunch of people. All Supposer, thank you for passing by. Thank you for the follow. I should also thank my new follows. I've been lucky to have quite a few this stream. First of all, thanks again for the raid, Wick, for Death of Certainty. Oily Olive. Yeah, unfortunately, I'm looking to end the stream here, because I've been streaming for 3 hours, but the VOD will be available on the Twitch channel and on the YouTube channel, so feel free to check it out. And also, I'll be looking to stream again on Sunday. I can watch a Max Miller vid if you like. I would say, don't send me like a 40-minute Max Miller vid. But hopefully something, 15-20 minutes, I can totally do. But yeah, I want to thank my followers, my new follows. All Supposer, Hyrillian, Armand Bigsby, the third Esquire. What 88, thank you for the follow. Don't Smile Dean, Politics for Life. And again, thank you so much for the raid, Wick, or Death of Certainty. I should shout you out again. Everyone should give... Whoops, that's not how you shout out. Death of Certainty. There we go. Thank you so much for the link, Oily Olive.
I've never met a mac and cheese I don't like. Whether it comes out of a blue box or is served with Gruyere and lobster, mac and cheese can do no wrong. And so I have high hopes for this 19th century mac and cheese recipe with the fancy name macaroni à la reine. So thank you to Bright Cellars for sponsoring this video as we celebrate gastronomy's power couple, macaroni and cheese, this time on Tasting History. So if you look at early macaroni and cheese recipes, they tend to be very simple: pasta, cheese, and butter. The channel Townsends did an excellent video on making one of these early 18th century recipes for mac and cheese, so I'll put a link to that in the description. But since John had already done the 18th century, I decided to move a little bit later to the 19th century when macaroni and cheese started to flex its muscles. And I found this recipe from 1845 for what I assume Eliza Acton thinks is macaroni and cheese fit for a queen, because she calls it macaroni à la reine. This is a very excellent and delicate mode of dressing macaroni. Boil 8 ounces in the usual way, and by the time it is sufficiently tender, dissolve gently 10 ounces of any rich, well-flavored white cheese in full.
I'm not gonna lie, I very much enjoy a good mac and cheese. And you know, I guess technically, so totally, there are some great vegan mac and cheese dishes that are out there that I totally enjoy just as much as whatever dairy, whatever real cheese mac and cheese. But like, yeah, one of the things that I miss, I guess, you know, whatever, eating dairy, like whatever, a well-made mac and cheese.
Fully 3/4 of a pint of good cream. Add a little salt, a rather full seasoning of cayenne, from half to a whole saltspoon of pounded mace, and a couple of ounces of sweet fresh butter. The cheese should, in the first instance, be sliced very thin. It should be stirred in the cream without intermission until it is entirely dissolved and the whole is perfectly smooth. The cheese may be poured equally over the macaroni, thickly covered before it is sent to table, with fine crumbs of bread fried of a pale gold color. Nothing too complicated in the process, and so it really comes down to what ingredients you're using.
Oh yeah, I don't think I have ever bought mac and cheese from a store.
So let's start with the macaroni. Now you can make your own at home, but you might run into the same problem that Thomas Jefferson did. See, he actually wrote down a recipe for making macaroni along with a diagram of a pasta machine. And then he had one of those machines sent from Italy to America so he could have fresh pasta made for him. But he quickly realized that the pasta was inferior to that he had had in Italy and in France, and it all came down to the flour. He noted that the best macaroni in Italy is made with a particular sort of flour called semola in Naples. So he ended up still importing pasta from Italy, which is actually how most people got their pasta for a very long time. And so, to be appropriate to the period, you're going to want a half pound or 225 grams of dried macaroni. The shape of which is really up to you, because at the time, macaroni could refer to pretty much any type of pasta. Eliza Acton even says that there is ribbon macaroni or lasagna, though the tube shape was becoming the standard when talking about macaroni. The one thing it would not have been is the elbow-shaped macaroni that we know today, because that wasn't made until a bit later. Now, one thing to keep in mind when you are choosing your pasta is that it's of a yellowish tint, by no means white, as one sees them when they are of inferior quality. So to prepare the pasta, she says to add a little salt and a bit of butter the size of a walnut to the boiling water before adding in the pasta. Now, she and other cookbooks from the time say to boil the macaroni at a full rolling boil for 3/4 of an hour. And that's after it's often soaked for an hour or more in milk or water. So I'm going to guess that they very much liked the pasta to be much softer than we often have it today, and the pasta was probably much thicker, so it did take longer to boil. Not entirely sure, but if you are going to boil it for a full 3/4 of an hour, that'll give you plenty of time to pop open a bottle of wine from today's sponsor, Bright Cellars. And I gotta say, wine does go very well with mac and cheese. It also goes really well with Thanksgiving pie. My dad, every year, the day after Thanksgiving, takes a lot of the leftovers and puts them into a pie and then bakes it. And it's absolutely fantastic. You get all the flavors all at once, and I always have it with a nice glass of Cabernet Sauvignon. Though if you don't like Cabernet, that's okay, because with Bright Cellars, you take a quick 7-question quiz, and they match you with wines from all over the world curated to your taste. The wines show up at your door and you enjoy. I also love these little cards that they send with information about the different wines. A little education with your libation. The cards tell you about the different flavors that you might find in the wine and where it's from, like this Cabernet from Chile with the whimsical name Dancing Juice. So whether you're going to be sharing this with holiday guests or if you're going to be keeping it all for yourself, give Bright Cellars a try by clicking the link in the description. And right now, Bright Cellars is giving viewers of Tasting History a limited time offer of $50 off of your first 6-bottle box by just clicking the link in the description. You can get started today. And not only do you get wine,
I don't know why I'm sitting through this
you
ad.
nurse need is Parmesan, but if Parmesan be used for it, it must be grated. But as we have said before, it will not easily blend with the other ingredients so as to be smooth. Use whatever you want. I'm using white cheddar. 1 3/4 cup or 425 milliliters of cream, 4 tablespoons or 55 grams of unsalted.
Mac and cheese by itself, pretty much like my go-to. So first of all, even when I wasn't vegetarian, I pretty much never ate seafood. I've literally never had crab. I've never had lobster. But guacamole with mac and cheese, I've never tried it, but that actually does sound quite delicious. Well, that's pretty much the reason why it just never appealed to me. And the whole process of eating lobster just seemed so, I don't know, really weird to me. I'm probably the most inexperienced when it comes to seafood. Never had crab, never had lobster. I pretty much never had shrimp. The only times that I've consumed shrimp has been by accident. When it was I had a little whatever, there was a little bit of it in a dish. That I didn't know was in it. Yeah, that's true too, totally. And whatever, I've never had. I've pretty much almost never had fish. I think the last time I had fish was when I was a child, and I maybe had some fish sticks. About it.
Salted butter, a half teaspoon of salt, a 1/4 teaspoon of cayenne.
Yeah, now that you brought this idea to my totally guacamole with mac and cheese does sound amazing. Not gonna lie.
And a 1/4 teaspoon of mace. You'll also need some dried breadcrumbs. So first add the cream to a small saucepan and bring to a simmer. Then add the cheese and stir it in until fully melted, and then add the salt, the cayenne, mace, and the butter, and stir everything in. And you can add more or less cayenne and mace to your taste. At the same time, put the breadcrumbs in a dry pan and set them over low heat, keeping them moving so they don't burn. And you'll notice it can take a little while to get those breadcrumbs to that nice golden brown that you want, and yet it takes almost no time.
Well, what I would say is, as much as I advocate for plant-based diets, I would hope at the very least that cow is no longer alive when you're biting into it. Otherwise, I would say that is barbaric.
Time to go from golden brown to burnt. Now with the breadcrumbs, pasta, and cheese sauce all going at the same time, you might not think that this is a good time for a lecture on the history of macaroni and cheese, but here it is anyway. Pasta with cheese goes back at least to ancient Rome. Cato the Elder's placenta, which I've made here on the channel, is essentially cheese between layers of a proto-pasta called tracta. By the Middle Ages, a dish with many of the same components begins to appear, lasagnes. The 14th century recipes usually call for pasta to be layered with cheese and then sweet spices like cinnamon and sugar. And the English form of curry from around 1390 has a recipe that just calls for pasta, butter, and cheese, and they call it macarons. In the mid-14th century, in the Decameron, Giovanni Boccaccio wrote of the town of Bengodi, a sadly fictional place where on a mountain all of grated Parmesan cheese dwell folk that do naught else but make macaroni and ravioli and boil them in capon's broth. And he says they would roll the pasta down the Parmesan mountain where people would scramble to get their hands on this mythical medieval mac and cheese. Now regional...
Well, again, I understand. Again, as much as I advocate for these things, I understand it's not for everybody. And believe me, Especially for myself, you know, for many people, or maybe like almost universally, food is understandably like a source of enjoyment. And if you are limited by your sources of enjoyment in life, then you probably don't want to limit your food options. And so like I understand these things, and like I'm technically like not vegan, I'm vegetarian. So like I'm not nobody's perfect, but like there's room for improvements that I can make. Uh, YouTuber who eat like seafood for millions of yeah, well yeah, I don't get me started on like whatever, just people eating on YouTube for the sake of eating. Like I can't stand that stuff.
Differences between macaroni also begin to appear. Naples, Genoa, Rome, they all had variations in the flour quantity, the shape of the pasta, and in their preparation. In 1465, Maestro Martino's recipe for macaroni romaneschi calls for it to be plated with good cheese, butter, and sweet spices. Similar flavors to the earlier recipe from England. And the macaroni connection between Italy and England is rather complex. It appeared in the form of curry in 1390, and then the first recipe called macaroni and cheese, or rather to dress macaroni with Parmesan cheese, appeared in Elizabeth Raffles' 1769, The Experienced English Housekeeper. But around that same time, there's a linguistic curveball thrown because in England the term macaroni not only referred to pasta, but also to a type of fashion. Yankee Doodle went to town a-riding on a pony. He stuck a feather in his hat and called it macaroni. Every American knows that song, and by the end of the American Revolution, it had become a patriotic ditty, but it actually started off as a bit of an insult to the colonists. Some claim that it was a way to mock the colonists by saying that they were so uncouth that merely by putting a feather in their cap they thought that they were fashionable. But I'm pretty sure it was actually a way to attack their masculinity. See, in the mid-18th century, it had become popular for the wealthy young men of England to take their grand tour, which was a lengthy trip around the European continent with a focus on the splendors of the Italian peninsula. While there, they would develop a taste for the finer things in life, elegant fashion, sophisticated manners, and an appreciation for top cuisine like the Italian macaroni. And similar to the Finer Things Club from The Office, these young sophisticates became members of what was called the Macaroni Club. And when they returned to England, they wore their ostentatious outfits and their bejeweled wigs. And had there been a RuPaul's Macaroni race 250 years ago, they might have become cultural icons. But that is not how it turned out. See, the style of dress coincided with a time where it was very popular to mock the wealthier classes, and the fashion just made it too easy. In 1770, the Oxford Magazine declared, "There is indeed a kind of animal, neither male nor female, a thing of the neuter gender, lately started up among us. It is called macaroni. It talks without meaning, it smiles without pleasantry, it eats without appetite, it rides without exercise, it wenches without passion." They were ahead of their time, and the style was short-lived, and the term macaroni returned to meaning pasta. But again, any pasta. Especially in Italy, any shape of pasta was still called macaroni. In fact, if you look at the many paintings and later photographs titled macaroni eaters, they are almost always Neapolitans eating long strands of pasta with their hands. More like fettuccine or spaghetti today. And that may be what Thomas Jefferson saw when he visited Italy in 1787, though he had surely come in contact with macaroni being eaten with a fork when he was in Paris. When he moved to France in 1784, he brought along his enslaved chef, James Hemings. And as Jefferson did his diplomat thing, Hemings was learning the art of French cooking. He studied under several of France's greatest chefs at the time and is often considered to be the first American chef trained in France. And when they returned to America, Hemings brought many of the recipes he learned with him, some of which Jefferson wrote down, like the macaroni. And I intend to do an entire episode on James Hemings, but for the purpose of this episode, it's important to know that it was likely his macaroni recipe that helped make macaroni popular in the United States because Thomas Jefferson pushed the dish on everyone. Shortly after he became president, Jefferson served a macaroni pie at a state dinner in 1802. Hemmings had passed away by then, but it was likely his recipe or a version of it that was used. And it's unclear if it had any cheese in it, and it wasn't actually a universal hit at first. One guest of the dinner...
Yeah, I guess, well, I think if you, I think if you zoom in close enough to just about anything, like very many things will have its roots in slavery or whatever as a result of a slave.
A member of the House of Representatives, Reverend Manasseh Cutler, said February 6th, Saturday.
And I said that laughingly, but like obviously that's a serious thing. That's not a laughing matter. It's more like, it's whatever, funny, sad type of thing.
Dined at the President's, dinner not as elegant as when we dined before. Among other dishes, a pie called macaroni, which appeared to be a rich crust filled with the strillions of onions or shallots, which I took it to be, tasted very strong and not agreeable. Another guest was Meriwether Lewis of Lewis and Clark, and when Cutler asked about the onions in the dish, Mr. Lewis told me there were none in it. It was an Italian dish, and what appeared like onions was made of flour and butter with a particularly strong liquor mixed with them. So he doesn't mention cheese in the dish, but after dinner he says, "We drank tea and viewed again the great cheese." And at first I thought maybe he was talking about the macaroni dish, but no. Rather, it is a wheel of cheese that was given to Jefferson as a gift. And Jefferson kept it in its own dedicated room, and people would travel for days just to have Jefferson invite them to the Mammoth Room and see the mammoth cheese. And if you think politics is divisive now, back then even the cheese was partisan, as the man who made it said that when it came to the milk used to produce the cheese, no federal cow must contribute a drop. And that might explain why Cutler was such a grump at the dinner, because he, like the unrepresented cows, was a Federalist. Now, while Cutler might have not been wooed by the macaroni, most of the population was, because it starts appearing in many of the early cookbooks from America, including The Virginia Housewife or Methodical Cook in 1824. It was written by Mary Randolph, and it does have cheese. And the fact that Mary Randolph was a close cousin to Thomas Jefferson and spent time with the family makes me wonder if her recipe is not in some way influenced by a version that James Hemming served 50 years earlier. Now, macaroni at this point was still mostly being imported from Italy, so it wasn't inexpensive. And so the dish, rather than calling it simply macaroni and cheese, would often be given more elaborate names, like macaroni à la sauce blanche or macaroni à la reine, like the one that we're making today. And even as the price of pasta started to come down, it was still generally known as a rather luxurious dish among the wealthy. But there was a concerted effort to change this. In 1855, Alexis Soyer, one of Victorian England's most celebrated chefs, wrote of vermicelli and macaroni. "Pray, Eloise, why should not the workman and mechanic partake of these wholesome and nutritious articles of food, which have now become so plentiful and cheap? Macaroni is now selling in London at 5 pence per pound, and makes 4 pounds of food when boiled." And it took a while, but eventually it did become accessible to the masses. But once everyone was eating it, it kind of lost its appeal amongst the wealthy, and so the fancy French-named macaroni and cheeses fell off of...
You can't have too many people eating mac and cheese, otherwise it just ruins it for everybody.
...the menus of nicer restaurants, especially those in the northern United States. But in the southern United States, it remained rather popular, especially amongst the African-American population. This is also where we start to see that divide between Southern soul food style of macaroni and cheese, which is made with real cheese, and the boxed version that's made with processed cheese. And for the evolution of that processed macaroni and cheese, we actually have to go to Switzerland, because both the macaroni and the cheese started there. It was in Lucerne in 1872 that elbow-shaped macaroni was first produced. And completely unrelated, in 1911, it was 2 Swiss food chemists who were looking for a way to extend the shelf life of Emmentaler cheese that came up with the first processed cheese. Basically, cheese takes a while to mature, but then once it is, it goes bad really quickly and can become poisonous if you eat it. And so they would melt it down to kill all of the bacteria and mold, and then add sodium citrate. That would keep the melted cheese from separating, and then it could be re-solidified into a block of processed cheese. But did the Swiss put their elbow macaroni and processed cheese together? No, it took a Canadian to do that. James Louis Kraft was born
Nice. Now the video is getting good. Talking about a Canadian.
in 1874 and grew up on his family's dairy farm in Stevensville, Ontario. In 1903, he went into the wholesale business when he moved to Chicago and started selling cheese to grocers off of the back of a rented horse-drawn wagon. The issue was with cheese's short shelf life, he had trouble selling in bulk, and during the summer without refrigeration, he had trouble selling it at all. So doing a little research, he came across the same process that the Swiss had and melted it down and then added sodium phosphate, which seemed to work better for his cheddar. He canned the cheese and sold it in bulk all year round. And in 1916, he patented the process just before America went into World War I. That's when he sold 6 million pounds of Kraft cheese to the American government to be sent unspoiled to the front lines in France. The cheese business boomed. He expanded and bought Velveeta in 1927, but still, the marriage between macaroni and processed cheese had yet to be realized. But then the Great Depression hit. The story goes that during the Depression, Grant Leslie, a Scottish salesman working in St. Louis, Missouri, was selling his pasta and to make it more enticing would put a rubber band around it with a packet of Kraft cheese. Well, Kraft saw this, loved the idea, and decided we could do that. And in 1937, they introduced Kraft Dinner, a meal for four in 9 minutes for an everyday price of 19 cents. One box could feed a family of 4, or a max of 1. 8 million boxes of Kraft Dinner were sold that first year, and by 1943, 80 million boxes were sold because during World War II, protein from meat and dairy were hard to come by. And that box of mac and cheese packed a lot of protein for just 1 ration coupon. It was also a quick meal for a time when women were working in factories and not at home cooking the complicated meals of years past. And even after the war ended, that quick meal was awful enticing, as one of the radio ads said, "Don't hurry, puff and wheeze, there's a main dish that's a breeze." Kraft Dinner first came in a yellow box, and in 1954 they switched over to the blue box. And as popular as Kraft macaroni and cheese is here in the United States, it's actually much more popular under its original name, Kraft Dinner, or now KD, up in Canada, where it's often called the unofficial meal of Canada. One thing I find interesting is that today we just take the packet.
I don't think here in Quebec, although this is not to say that nobody in Quebec, like people in Quebec still buy Kraft Dinner. I don't know that Quebecers would consider Kraft Dinner like official meal of Canada. Yeah, that's a good question. I don't know.
Of cheese and mix it with some milk and then the pasta and you're good to go. But in 1938, when it first came out, they actually had recipes to kind of spruce it up. And one of the first recipes had a pinch of cayenne pepper, just like the Victorian recipe that I'm about to eat. So once all of the components of the mac and cheese are ready, put the drained pasta into a dish or a pan and pour the cheese sauce over it, making sure everything is well coated. Then sprinkle on the toasted breadcrumbs and serve. And here we are, macaroni à la reine, fancy Victorian mac and cheese. Here we go. All right, straight off, my favorite part, the breadcrumbs. I could put like a whole loaf of breadcrumbs on here. They just add such a wonderful texture. The rest of the texture is like macaroni and cheese. I mean, very, smooth and creamy with the texture of macaroni. The flavor is really going to depend on what cheese you use, because I'm not getting a lot of, I take that back. I am getting some of the mace and and that cayenne, especially at the very, very end. It takes a second. At first, it's like all I'm tasting is the cheese. And it's wonderful, but like I said, whatever cheese you use, that's the main flavor. But then you get that mace and that cayenne. What's interesting is it actually reminds me of the rice soup in the Third Class Titanic video. And thinking back on that, the main ingredients, the flavors there were mace and cayenne. And it's kind of from around the same period. It's about 50 years later, I guess. But that's really interesting. Basically, instead of cheese and macaroni, it's rice and milk with those spices. So you should give this one a shot, or any of the other old macaroni and cheese dishes, and definitely put breadcrumbs. I'm gonna start doing that just on like Kraft macaroni and cheese, because that's really, really fantastic. So make a bowl of mac and cheese, and I will see you next time on Tasting History.
Good video. As always. And as always, thank you, Olive, for sending it, providing the link. So yeah, now I'm gonna look to end the stream here. So this is definitely not my area of expertise, because like I don't follow the cooking world, and I'm definitely not a skilled cook or chef myself. But I think like I think traditionally most chefs, or like noteworthy chefs, are male. Just because I don't think. I'm pretty sure like back then, whatever, yeah, sure. Whatever, traditionally, women do the cooking. When it comes to like professional chefs, or like culinary school, I don't think women had like the greatest access to those things. And also just when it comes to whatever, owning restaurants or entrepreneurship, generally speaking, women were not given access to these things. And so I don't think, this is just my suspicion, I don't know for sure. But I don't think the noteworthy chefs of history are dominated by women. I would suspect that's mostly a male thing. But I could be totally wrong. I'm just thinking out loud. But let me set up the raid again. Put it here. And yeah. So, again, thank you everyone for passing by. Much appreciated. Had 2 great streams today. Had a great workout stream. And just had a great stream now, covering science and news. And again, thank you again for the raid, Wick Death Certainty. I am now I've surpassed 500 followers, which again is insanely wild to me. Exceeds my expectations. And like, yeah, I never thought I would make it this far. Here I am. And hopefully it only gets bigger from here. And yeah, thank you for sticking around, Readsters. We're gonna raid into Squidadere. Gonna set it up, start. And so yeah, that's it for tonight. I plan to stream again on Sunday, another science and news stream. And actually, I've been given a topic to cover, covering genetic testing, like 23andMe, Ancestry.com, and maybe how, I think there's some serious, or not serious, there are some issues, and people are pretty much like giving too much credibility to these tests. So that's basically what I hope to cover and prepare for on Sunday. And so yeah, we're gonna raid into Squidadere. If you're not following them already, you should. Another fellow lefty streamer, make great content. And yeah, until next time, take care and be well.
Corey Campbell, holy fuck.
Play Whip It!
No, play the other one.
Welcome in, Dr. Corey Campbell.